Everybody, and welcome. Thank you so much for being here in this panel. And let me introduce myself, and then you'll meet our incredible researchers here today. I'm Amber Payne. I am the publisher and general manager of The Emancipator. And The Emancipator is a reimagining of the first abolitionist newspapers for a new day, with a focus on identifying and explaining the solutions to racial inequality. So this is really the perfect place for us to be today, to be hearing from you and learning from you, because The Emancipator is just a year old. We launched a year ago this week, and we are named after the first abolitionist newspaper, which was founded in Jonesboro, Tennessee in 1820. And just like those 19th century abolitionist newspapers, we take inspiration from them. They were calling for something that people thought was impossible and unimaginable, the end of slavery. They were not moderate about it. They were not wavering. They were not, maybe in a few years or in 100 years we can figure this out. They were calling for it, the immediate end of slavery. And it was by having those powerful voices, making the argument, making the case for humanity, they really had an impact on the community. And so we take inspiration from those papers because we're talking about the end of racism, the end of inequality, which so many people cannot imagine is possible. And so by evidence-based commentary and solutions journalism, we are producing stories and multimedia video commentary, social first approaches, and events in communities, solution circles in communities, and really listening to communities and reflecting back upon them. Because while there's research taking place at the highest levels, there are also people in the communities who, they're experts on their own lived experiences, and they know what they need. So we're talking about listening to those communities. And I'm really excited to listen to our researchers today and our panel today. And the way things will go, we're gonna have them present one by one. So I'll introduce each of them. I will introduce our provocateur today, and we'll have a little bit of back and forth after each panel. And we'll absolutely have time afterwards for the audience, for you to ask any question or to comment on something that you're working on that's related to this field, because we're all here because we want to learn from each other. And you know, I'm sure that there will be also time at the very end if we want to get into any other breakout groups in the room and dive into something. So with that, I'm going to introduce Peter Cherchek of Boston Indicators, and his presentation is on Great Migration to Global Immigration, a profile of Black Boston. So I'm going to let Peter step up and tell you a little bit about himself and who he is and what he does, and then he'll get into his presentation.
Hello. Thank you for having me. So as Amber mentioned, my name is Peter Cherchek, and I am the research analyst at Boston Indicators. And on behalf of myself and my co-authors, Luke Schuster and Dr. James Jennings, who are both unfortunately unable to be here at the moment, I'm here to talk to you about Great Migration to Global Immigration, Profile of Black Boston. Now, over the next 10 minutes, I'll be walking you through kind of a demographic overview of the Black population of Boston and the region, exploring a bit of the diversity within our community here, and getting right at the end into a bit of the socioeconomic indicators and disparities within our community here. So without further ado, let's get into it. The first slide I'm going to show you looks at the total Black population share of the city of Boston going back to 1850, and we'll see some trends at the big level. So back in the early 19th, mid 20th century, Boston's Black population was relatively small. It was made up of folks who were previously enslaved, their descendants, and a small number of folks living here who had come from abroad. In the mid 20th century, you see a big increase, reaching its zenith in about 2000, before falling somewhat to about 26% of the city by 2020. Now, the next slide is going to answer the question about where are these folks coming from? And here we look at birthplace of Boston's Black population. And here we stick with Boston in particular because the greater Boston region hadn't necessarily been defined so much. But we see two major waves of migration to the city. The first, as a result of the Great Migration, and that is the large-scale movement of residents from the south to the north, settling in Boston as well as New York and Chicago and other areas at much greater numbers. And we also see, beginning in 1965, the effects of the Hart-Celler Act. And that opened up immigration to the US, and in particular to Boston. So we see this kind of increase of the foreign-born Black population here in the city. And if you looked at the Asian community or the Latino community, you'd see that similar increase beginning around 1965. Now, the next slide I'm going to look at gets at a bit at the difficulty of measurement and choices we make as researchers to understand our population here in the city and in the region. So you might be familiar with a graph like this. It's more or less the population of Black Boston, looking at all those respondents on their census form who selected Black alone, no Latino. And this is a perfectly accurate way of representing our population. Between 1990 and around 2020, it's been relatively steady. There's been a bit of a decline since 2010. But throughout this paper and throughout this presentation, we decided to take it a step further and say, if people are responding Black on their census form, whether or not they are responding with white or Black or Latino or Black, they should be counted towards our Black population because that is how they identify. So when we do that, it's actually the difference between a slightly shrinking Black population within the city of Boston and a slightly growing one, down around 8,000 since 2010 or up around 8,000 since 2010, and 26% of the city versus 19. And we do something similar for Greater Boston as well. Now, I'd also like to draw your attention to 1980. Back then, around 76% of Black residents in the region lived in the city of Boston. But by 2020, that's almost completely flipped, and about 2/3 of Black residents of the region now live outside the city. So where do they live? This map looks at the share of municipality that is Black, by our definition again, and the share of a census tract within the city of Boston that is Black. And you can see there's this corridor of Black residents and residencies down the center of the city, through to Milton, through to Randolph, and culminating in Brockton, which is the only majority Black city in New England, again, by our definition of this paper. And these are people who have left the city or have settled here because they are able to buy homes, kind of pushed out by affordability reasons, or are able to kind of create community in a way that is difficult in many of these other municipalities. Take a look, for instance, in the North Shore, the South Shore, very small Black share of the population, or Metro West, again, exclusionary zoning, a lot of ways in which Black communities are made to feel unwelcome. So we know, and we emphasize throughout this report, that our Black population is not monolithic. So I'm going to take you through a couple of quick demographic breakdowns of our Black population here, rounding out with some socioeconomics indicators. So we're looking first here at ancestry. Now, ancestry is an actual question on the American Community Survey that says, how do you culturally identify? So it doesn't necessarily mean that you've been born in this place, but you have a tie, or your parents were born and came over, or your grandparents. And in Greater Boston, our international heritage is significantly strong for our Black population. About 15.2% identify as Haitian, Dominican, Jamaican. And as you might imagine, especially as compared to the US, those Black residents of the region who identify as African American or Black is significantly smaller. And you'd be right, it's about 27% of this region that identifies as Black or African American, as compared to about 2/3 nationwide. Now, let's look at foreign-born population. You might have gotten a hint of that in a previous slide, but when we do look at the foreign-born share of the metro area entirely, we see it's significantly larger than the US, about 4 times. And in fact, when we look at metro areas overall, Greater Boston as compared to, say, Minneapolis or Miami, there is no other large metro area that has this large of a share of foreign-born Black residents. There is none other in the country, and that is remarkable. Another aspect of our growth here has been the Afro-Latino population. Has doubled since 2000, Settling, of course, in Boston, Lawrence, Lowell, and Lynn, with knock-on effects of politics, representation has increased across both Massachusetts legislature and here in the city overall. Now we're going to switch gears and look at some quick socioeconomic indicators, again, much more in the paper itself. But we're going to look at median household income broken up by native-born Black residents, foreign-born Black residents, and Afro-Latinos. And when we do that, we see there's kind of a little bit of a disparity here. Foreign-born Black residents have the highest median household incomes among Greater Boston's Black residents. And we don't get too in-depth in this in the paper, but some ideas that we kind of kicked around were educational attainment may play a role here, potentially more earners per household. Of course, the legacy of systemic racism in our region and in the country. But we also have to put this in the context of Greater Boston and Boston overall. And here, it remains a large income gap as compared to 93,000 or 75,000 in the city. And this gap persists when we look at homeownership as well. Looking at households of 35 years of age and older, about 73% of these households, or 73% of white households own their own homes as compared to 40% Black or 37% Latino. And you might think that has something to do with income, but when we look at income and control for area median income, that gap persists. And in particular, I'd like to draw your eye to the up to 50% of area median income. And this right here is kind of a stark reminder of the GI Bill of exclusionary zoning, where white residents of the region own their homes at a much higher rate, even kind of within this income bracket, than do Black or Latino residents overall. So thank you for your time. I really appreciated being able to talk to you all. We get into a lot more detail in the report, ask some questions about how we should be measuring our population, whether Black or Latino or Asian, and I encourage you to check it out. We've got some flyers out front. Thank you. So now I will wait.
Yes, now you'll wait.
There
Thank
we
you,
go.
Peter. We're going to cross behind you here, and I'm going to invite Raquel Halsey up, who is our provocateur. And Raquel, have a seat. And actually, do you want to sit here? Sit here. Sure. And please introduce yourself and tell us who you are, what you do, and then let's get into your feedback here.
Sure. Good afternoon, everyone. My name is Raquel Halsey. I am the Executive Director for the North American Indian Center of Boston. We are Massachusetts' oldest urban Indian center. And I am also a Boston transplant, or a transplant to the Boston area. I myself grew up in the DC area in Maryland, and my tribe is in North Dakota. I am a member of the Mandan, Hidatsa, and Arikara Nation.
Well, welcome to the stage. Peter, thank you for that presentation, and I really do appreciate you getting into just this idea that the Black population is not a monolith. It's something that the Black community, being a member of that, we say it a lot. We have different backgrounds, and there are different cultural nuances, and this really is something that also we can learn from when it comes to homeownership and socioeconomics and where we live, because so many of these communities are clustered. But that's all I'll say for now. I'm going to turn it to Raquel for your thoughts and comments.
I had the same thought. I think like the Black population, like the Latino populations, folks tend to think as Native Americans or American Indians and Pacific Islanders, other indigenous peoples, as a monolithic culture. I was really happy to see the work start at the Boston Globe, but I also feel like it's a little late for this type of deep dive into the data, and I'm also wondering, how did this come about? What connections to community was it rooted in? And if there's any particular folks within your community or your research community that have helped to bring this type of data to light?
Sure, yeah, thank you, great question. This is a much truncated version of a much longer presentation that we did released at Roxbury Community College back in early April. And Boston Indicators works with community on a number of reports like this. We've worked with the Gaston Institute for a report exploring Latino population, Avancemos Ya. We worked in a multiracial paper, we published that a while ago. We work in collaboration with the Asian Community Foundation at Boston, the Boston Foundation, for a piece on the Asian American Pacific Islander community here. We worked on this with Professor James Jennings at UEP, Professor Emeritus, who is deeply connected to a lot of these communities, and especially the Afro-Latino community here in the region, and has a long history of working with the NAACP, as well as a variety of other groups, and is on a couple BPS task forces, I believe, as well. He was unfortunately not able to be here, but we certainly approached this this work through our kind of research lens, and it is part and parcel of work we have done in the past with the Kanawha Institutes, with those members that I've already mentioned. And this work came about because we had been doing all of this work, and we've been percolating, thinking about kind of how to kind of expand on our data-centric, to be clear, work, looking at the data sets and looking at how to interpret them, and doing it in a thoughtful way. So we brought James Jennings on board, who's very, very good and has been a delightful person to work with, to help guide us in this process as well. And we know that, you know, myself and my co-author Luke Schuster are both white. And we understand that this is a very kind of important thing to get right. And that's why we did do all that kind of outreach and try to find the people, the right people to talk to about the work that we do. So, and we consistently do it through indicators, through other reports, and whatever we do next, we will be sure to make sure we reach out to those research communities.
When you go through this process and you are able to spotlight the type of missing data that communities of color have been looking for and unable to find in most of the public data that's out there, are there, or I guess, what are the pathways that you see forward to working through some of the socioeconomic impacts that you can clearly see in the research, but now there's a responsibility to start addressing that, and for I'm interested in, you know, what type of partnerships you're developing or have developed with cities, city governments, with some of these institutions, but also, you know, even workforce development programs and spaces that will develop those pipelines to make sure that research in the future can also be done by people from those actual communities that are responding to these surveys and such.
Yeah, thank you. So this particular, we thought of that kind of question as somewhat out of scope, but we did ask some questions at the end, like how can we advance this work with regards to data collection? And we had a panelist who was going to talk about that, but unfortunately he was not able to make it here. But a lot of our other work actually works in collaboration with SkillWorks or workforce development, or a report that we're working on right now, which is exploring kind of home ownership programs and bringing them to the fore and helping to say, like, okay, these are the programs that are available. How can we highlight them? How can we make sure people get access to them? But we are, to a certain extent, a think tank. We digest and repurpose and send out these reports, and where it is possible to work in collaboration with those kinds of organizations, we do. But more kind of specifically around this report, around other things, we do think there's a value of putting that information out there so people can respond to it and take it on their own. And often we don't know the lifespan of these things. We don't know who's going to take it and run with it. We've heard back from a group, MAPS, which focuses on the Portuguese community in the region, and they want to use the data, and I'm talking to them next week. Or Massachusetts Legal MLRI, I can't remember exactly what they stand for. And I'm talking to them about like race and ethnicity data. So we make ourselves available, we put the data out there, and when people and organizations get in touch with us, we are more than happy to provide as much information as we can.
All right, well, thank you so much, Peter.
Thank you so much.
We're going to be calling you back up here for the Q&A session.
Sounds like a plan. All right.
And we'll ask you some more things, but we appreciate your presentation.
Thank you, Amber.
All right, so next, thank you. Let's give him a round of applause, yes. And welcome Clemens Nolke to the stage. And he will be speaking about quantifying racial disparities in the quality of children's neighborhood environments. And I'm definitely very interested to see this being familiar, as many here probably are, with the work of Raj Chetty and the Opportunity Index, and just this idea that where you live can determine the outcome of your life, what kind of opportunities you literally have, educational, healthcare, having a grocery store near you, and everything is so interconnected. So welcome, Clemens, and please introduce yourself, tell us a little bit about what you do, and then let's get into your presentation.
Thank you, Amber. My name is Clemens Nölke. I'm the research director for diversitydatakits.org, where I lead the development of the Child Opportunity Index. I want to start by just acknowledging my team. We are based at Brandeis University at the Heller School. The project is led by Dolores Acevedo Garcia, and we're currently receiving funding from the W.K. Kellogg and Robert Wood Johnson Foundations. I want to start with a simple motivating question, which is on the minds of many policymakers and program administrators these days, which is, how do we allocate resources equitably across neighborhoods? There are massive inequities in access to neighborhood opportunity across the US, and because of segregation, there are also massive inequities by race in terms of access to opportunity. So if we invest equitably in our communities, we not only reduce inequality in terms of access to opportunity across neighborhoods, but also across racial ethnic groups. So here's an easy way to think about it. So how do you plant trees equitably? You can, in this example, replace trees with pretty much any other place-based investment. So this is the city of Akron in Ohio. They have allocated, let's say, funds to plant 10,000 trees, but where do you plant them? So first, you might focus on areas that are currently low in tree canopy, that have known heat islands. Second, you might also consider equity. So is there a way of planting or investing that reduces inequities in access to healthy neighborhood environments? And so this map shows neighborhoods, or identifies neighborhoods that have both low tree canopy and are low opportunity. Why not invest in those places first? And the Child Opportunity Index is one tool you can use to make these for these kinds of applications, and that's what I want to talk about today, and talk about how it compares to other metrics in this space. So the Child Opportunity Index is a composite index that captures 29 indicators of neighborhood features that help children thrive. It is neighborhood level data for the entire US, comparable over time, and I should mention that we're currently working on an update, COI 3.0, which has data all the way through 2021, will be launched later this year. The index has good predictive validity compared to similar metrics and has many users now from many different sectors. Why do we need a Child Opportunity Index? First, we find that it's more predictive of a range of outcomes than either single metrics or its component metrics or rival neighborhood indices. If you're looking for a neighborhood measure that sort of comprehensively captures all the aspects of neighborhoods important for children, the COI just tries to be just that, so it has better content validity than similar composite indices of neighborhood opportunity. And in many applications, it's just easier, to track a single index than, let's say, 20, 30, 40 neighborhood indicators. Lastly, we think it better captures racial ethnic inequity and access to neighborhood opportunity. So a valid measure, in our view, or a measure with equity validity, as we call it, should powerfully capture the racialized geography of opportunity. For example, a black child compared to a white child more often lives in a neighborhood that's not only poorer, but where the schools have fewer resources and where overall pollution levels are higher. So, and we think a valid measure needs to capture these compounding, multidimensional sources of disadvantage. So what indices are out there? So the closest analogs to the COI are the area deprivation and the social vulnerability index. The area deprivation index is constructed from, commonly used measures of neighborhood socioeconomic status, like the poverty rate, measures of educational attainment, measures of housing quality. The social vulnerability index has been built by the CDC to aid disaster preparation. So it has metrics such as the percentage of the population living in group quarters like dorms or prisons, which is important to know for evacuation management, for example. The Child Opportunity Index also includes some of the same socioeconomic indicators, but it tries to be multidimensional, more comprehensive. It also includes measures of the physical environment, such as exposure to pollution or access to green space, as well as information on access to early childhood education or the quality of schools. One important question here is whether or not racial ethnic neighborhood composition should be included in the index. Empirically, it's been often demonstrated that neighborhood racial ethnic composition predicts children's outcomes, even with individual race controlled. But from a policy standpoint, we think it's problematic to associate the presence or absence of specific groups with opportunity. So what we do is omit racial ethnic composition from the index, but develop an index that's strongly correlated with it, and we highlight whenever we can the strength of this association, which is now non-trivial because we didn't already include it in the index. There's different ways you can build indices. You can just simply average everything together. What we did for COI 2.0 is weight indicators differentially so that indicators that are more strongly predictive of a set of health and socioeconomic outcomes count more. The SVI and the ADI were constructed with principal components analysis, which is just a statistical technique to reduce many highly correlated variables into one. So what kind of patterns do we see with the COI? The inequities that it captures really matter for children's outcomes. So this is life expectancy at birth, averaged across neighborhoods with the same levels of opportunity. You see a 7-year gap between very high and very low opportunity neighborhoods. Here we looked at children's mortality directly in individual level data, a representative sample of children. We find that in children growing up in very low opportunity neighborhoods have a 40% increased mortality risk compared to children growing up in very high opportunity neighborhoods. Children in very low opportunity neighborhoods have also a 60% increased risk of experiencing the death of a caregiver, a grown-up in their household. So there's now about 50 studies that have been using the COI to do these types of analysis, mainly focused on pediatric outcomes, and many of them find these rather steep linear gradients. But what's not clear is how the index compares to other or similar metrics that are out there empirically. So one more thing here. I think one important driver behind these unequal mortality risks that we see is gun violence. So this is 2020 data from 44 US children's hospitals across the country. And among the children who had hospital encounters for a gunshot wound, 50% or nearly 50% came from very low opportunity neighborhoods and only 5% from very high. So very, very steep gaps. But how does the index compare to the other ones out there? It's an important question, right? So if you're a scientist or an administrator, which index do you use and how do you make that decision? And there's still very little information out there on how these indices compare. So this is our own initial analysis. What we're doing here is comparing 4 neighborhood metrics of opportunity, or that have been used as such by many researchers or practitioners. And those are the poverty rate, so the social vulnerability index, area deprivation index, the COI, and then a measure of intergenerational mobility from the opportunity from Raj Chetty's Opportunity Atlas. So in the top row, we're comparing the shared variation between these neighborhood metrics. And they turn out to be quite highly correlated. So there's between 50 and 80% shared variation, meaning that these metrics capture some or a lot of the same things about neighborhoods. Following row, we're looking at how strongly they're associated with life expectancy. This ADI is slightly more strongly associated with it than the COI, which we think is due to the fact that it was initially constructed to predict mortality in particular. But if you look at the range of other outcomes, the COI does outperform these metrics or does about equally well. So if you average across these 10 outcomes, sorry, it's got a little misaligned here in the conversion to Google Slides. So if you average across these outcomes, the COI explains about 44% of the variation in outcomes. The poverty rate is next, 39%, and the other metrics explain about 30 to 35% of the variation. Lastly, we're looking here at the percentage non-white children, or the strength of the association between the index and neighborhood racial ethnic composition. The SVI outperforms the COI here, but one reason for that is that it includes the percentage non-white children in the index, or non-white residents, I should say, in the index, so that it's a bit of an unfair comparison. So overall, this is preliminary evidence that the COI does about as well as other metrics, perhaps better, in explaining a range of socioeconomic and health outcomes that's been confirmed by 2 recent studies. It's the only multidimensional metric that really tries to measure neighborhood conditions for children more comprehensively. And it has a number of different users. We've ourselves supported many applications of the COI. We've worked with academics, nonprofits, organizations big and small. And if you're interested, please reach out. Send us an email. We do respond. Sign up for our mailing list if you're interested in COI 3.0. And yeah, be happy to hear from you. Thank you.
Thank you, Clemens. And stick with us. Raquel, I'll turn to you for your thoughts.
I'm actually a little surprised pleasantly that that was some of the most in-depth data that I've been able to look at related to the health outcomes of children. So thank you for that. Thank you for that work. And I'm really curious how you created these coalition spaces for folks to design this type of data collection.
So you're asking me about the sort of the kind of people who were involved in developing this metric, and okay. Well, it was initially developed, I think, at the Kirwan Institute at Ohio State University, and initial application was for a court case where residents of the city of Baltimore sued the city and HUD for essentially where public housing was located. So there was the case. So like high-rise public housing was torn down, and the proposed sites for rebuilding were essentially in the same low opportunity areas, and they needed a metric to make this case in front of the court, and the residents won, and then the metric was also used, the opportunity index developed at the time, in the remediation, so to relocate people out of the city and into the surrounding communities. I mean, we source our information, from when we build this and decide what goes in from many conversations with different users of the data. So what would they like to see in there? But also we have to look at the research evidence, what really is important in terms of the causal effects, of those things. So we try to find a good trade-off between those two, so between community input and the research evidence.
Short of a lawsuit, what are some ways that the research community can do this on its own?
What do you mean, do what?
I think start to redesign. I feel like it's really redesigning how we think about research and what's important and what it's for, and it shouldn't always have to come from a very real and urgent threat, I should say, that a community is facing?
It's a very complex field, yeah. I think one distinction that we make is sort of between local and national tools, yeah, or local and national data collection and activism and community involvement. If you think about a city like Boston, there's many more opportunities, to involve residents and communities in local research initiatives and make them part of the design, the governance, and also make sure they receive, the benefits or at least the results of those findings. We work nationally, right? We try to do this for every community in the US and make that data available to them. We can't be on the ground in all of those 75,000 neighborhoods. So we then work with intermediaries, right, who are local and who then do this work, sometimes on our behalf or with our support.
Who are the intermediaries?
Oh, that's a very it's a great question. I mean, it's sort of it's a wide range of people and organizations. Like a lot of the academics here in this room are organizations. They might be intermediaries, right? They work with nonprofits or people in the community, try to do community-focused research, with the involvement of the people, and also then bringing in what they have as, in terms of intellectual capital or data and such. So that's academics, like profits, networks such as BARI or the National Neighborhood Indicator Project or a network called DASH, all of which are sort of locally, which include a lot of locally active organizations that try to support community level research with quantitative data.
And if there are folks connected to communities who are in need of data in this room or watching, how would you suggest that they find their way to people like you, organizations that you've worked with on this type of data, to get at what they really need?
I love this question. I think it's a great question. We talked about this in a team meeting actually yesterday, and we worked with one community coalition here in Boston, the Living Safely in Jackson Square Coalition. I did some analytics in support of a grant application. The way they heard about us is through a radio interview. So one of the coalition members, they just called up the PI, and the PI picked up, and then we had a meeting, and then we did pro bono work for about a year. But I'm not sure if there's another mechanism, which is a big problem. In an environment where data is becoming more and more important, or more and more organizations are expected to use it somehow in order to support or document or show impact, there needs to be a much more developed local mechanism where intermediaries, knock on doors and make sure that no one's, left behind in this shift towards sort of more data.
Well, I know that the Emancipator would love to amplify the work you're doing. I'm getting some story ideas here because, I know media coverage is important, and that's how people learn about what you're doing and get to know who you are. And, finding a way to translate data is also just, you're creating, you're correlating and coming up with this comprehensive data, and then how do you get that data out? I think that's just something that we also, at the Emancipator, we feel like that's part of our mission, okay? We want to work with scholars and researchers about the data, and how do we take this big chunk of data and this report that doesn't translate to the layperson, but get it into their hands?
That is very difficult work.
Yeah.
I mean, we are like data scientists mainly, that is sort of our day-to-day work. We are like mining and sort of aggregating very large databases. And it's an entirely different work stream, essentially, to pick out what are the interesting stories here for people in specific communities. There's a lot of development that needs to take place so that happens at much larger scales than it currently does. There need to be more stories like Peter's told. They could tell so many stories, right, with the data that's out there, and you do repeatedly, but there could be much more detail, much more sort of community focused, trying to help really the people in the different Boston neighborhoods tell their story most effectively with the data that's out there.
I noticed you have this submit your story, so tell, what happens, what kind of stories get submitted? What should we submit?
I mean, so those are more people, I think what we get there is people who've used the COI and they want us in an interesting way. Yeah. We publish those stories on our website to show others, this is how the data can be used in an applied setting. Let's say there's a housing mobility program here in Massachusetts, the Supporting Moves to Neighborhood Opportunity Project that uses the COI to define opportunity areas. And then we talk about this, and there's an evaluation underway of this. And so it's those kind of stories to give people like practitioners in the field a sense of, what can you do with this data and how are others using it.
Well, thank you so much. Thank you for your presentation. Let's give a round of applause for this. And we'll invite Nikki Shen to come up to the podium. She is with Boston Public Health Commission. She'll introduce herself and be talking to us about the association between experiencing racial discrimination and hypertension among Boston residents.
And I'm going to go ask her just a little bit to answer what your question was, which is that I think that, not to suck up too much, but I think that BARI is a really great opportunity for making these connections, because I can see in both of these presentations something that I work for the city government or we're pseudo-governmental, and I can think of 1,000 ways that we can use the presentations that I've seen today, and my team is here as well, and I'm really, really excited that BARI was able to make that connection happen. But back to my own work. I am Nikki Shen. I work for the Boston Public Health Commission in the Department of Population Health and Research. And I'm really, really excited today to be here to tell you about our study on the association between experiences of racial discrimination and hypertension among our Boston residents. I should start by saying that the funding for this research, both the data collection and for my time to do this research, came from the City of Boston, and I have no conflicts of interest to disclose. So as background for what motivated this project, experiences of racial discrimination have long been shown to be associated with various negative health outcomes, and those associated outcomes are both mental, such as depression, anxiety, et cetera, and physical, cardiovascular disease, low birth weight, many more. Community survey data provides an opportunity to estimate these associations and these links in the overall population of a community. And our motivating research question was just, what is the association of experiences of racial discrimination with lifetime hypertension? And I'll talk a little bit about our methods. So the methods is, the community survey that I was alluding to is one that we call the Boston Behavioral Risk Factor Surveillance System, which I will call the BREFIS here, and we used 3 waves of it. We used 2017, 2019, and 2021. The BREFIS is a semi-annual, so every other year, survey of our Boston residents that's done by my organization, the Boston Public Health Commission. Health researchers in the room might have heard of the CDC BREFIS. This is very similar. We take a lot of inspiration from that. And like the CDC BREFIS, participants for our survey are sampled using stratified random sampling, such that when we apply sampling weights to analyses of the data, inferences are representative of Boston's adult housed population, because we sample in households of people who are 18 and older. A little bit, every good epidemiological study, or many good epidemiological studies, have an exposure and an outcome. So let me talk a little bit about our exposure of interest, which was self-reported experiences of racial discrimination. In our case, it's a composite exposure that was defined as responding in the specified ways, which I've highlighted in this red-orange color, to any of the 3 questions on my next 2 slides. So we asked our survey respondents, in your day-to-day life, how often are you threatened or harassed, and asked them to cite due to their race or ancestry. And if they mentioned that an experience like this happened to them more than once a year, we counted them as experiencing racial discrimination. Or if they responded that they receive poorer service than other people at restaurants or stores due to race or ancestry more than once a year, or if they ever have felt that they were stopped by the police just due to their race or their ethnic background. So if you responded yes to any of those questions, you were counted as exposed to racial discrimination per our definition for this study. A little sidebar before I go on to the outcome. Racism manifests in different ways. This Lafave paper I really recommend. It's a good read. And it defines that racism and racial discrimination can be interpersonal, so person to person, just one person treating you worse due to your race or ethnic background. It can be institutional. If an institution like a school or a hospital has a pattern of behavior of treating people worse due to their race or ethnic background. And then there's obviously structural and systemic racism, which is not just an institution, but the confluence of institutions and systems and laws in an area that discriminate based on race. The data that we had access to mainly describes experience of interpersonal and then specific forms of institutional discrimination. We only had access to those 3 questions that I've outlined on the previous slides. For simplicity, we're going to be referring to this exposure as racism or discrimination in this presentation, but I want to acknowledge that limitation up front because it's a very complex and nuanced discussion. The outcome is has a lot less nuance to it. It's simply defined as a yes to the following question. Have you ever been told by a doctor, nurse, or health professional that you have high blood pressure? If they answer yes, we mark them as having a lifetime or ever hypertension. For our analysis, we did logistic regressions of hypertension on self-reported experiences of racial discrimination. We did it in the overall sample as well as within race ethnicity strata. We adjusted these regressions for age, sex, and educational attainment as our best simple proxy for socioeconomic status. And then, as I alluded to earlier, we weighted these regressions, so these associations that I'm going to present should represent the housed adult Boston resident population. On to my results. This is not the full results. These are not the results of those regressions, but it's a simple sort of frequency table of the exposure and the outcome among these strata. And these are weighted, survey weighted, so I don't present ends, like not the number out of 9,000 residents, but these should be the proportion of the sample after, or the proportion of Bostonians that experience this. And just to go through it really quickly, there's not too much of a difference in hypertension between our male and our female respondents, but their females did seem slightly less likely, per those definitions, to report racial discrimination. Racial discrimination was lower among people who had attained college or more levels of education, and the incidence of hypertension was also lower with higher educational attainment. As you'd expect with age increasing, your hypertension rate goes up by a lot. It's an age-linked disease. That wasn't a surprise to us. We were a little surprised to see that reports of racial discrimination were lower among our highest age group of 65 and older, but it seems pretty similar in the years before that. And then just to look at our race ethnicity strata, just to present here, the reports of racial discrimination were highest among Black Bostonians, both non-Hispanic Latino and Black Latinx, and lowest among our white residents at only 5%, white non-Latinx residents at only 5%. I should make a note that in this, the preface does ask about ancestry, and you're allowed to endorse multiple races. Just for sample size, in this analysis, mixed race people are asked what race they primarily identify with, and were put in that bucket for this analysis, for lack of a better term. And those who declined to choose were grouped into other. I acknowledge that this is a limitation. When we get more years of data, these questions were only asked in these 3 years. When we get more years of data, I would love to do a more sort of nuanced look at race, ethnic, and ancestry background. And these are just further bucketed, even smaller. Okay, and this is the main result here. So big picture, let me explain a dot to you. If you look in this orange section at the bottom, this is the odds ratio. And to explain that dot at the bottom, this line going up and down the middle is 1, at which point you would assume that hypertension and racial discrimination had no association. Anything that's to the right of that indicates that there was a positive association between racial discrimination and hypertension. So here, this 1.4 stands for that overall, in the general sample, people who experienced racial discrimination had 1.4 times the odds, AKA 40% higher odds of lifetime hypertension compared to those who said that they did not experience any discrimination. These odds ratios are adjusted for age group, sex, and educational level. And then I would take our race ethnicity strata a little bit with a grain of salt, because these are, even when bucketed into large groups, these are smaller, but you'll see that by and large, with the exception of our white non-Latinx residents, racial discrimination was associated significantly in some cases, not significantly in others, with a higher incidence of, or higher odds of hypertension. We also looked at the components of this, of our exposure, and to see if any of these was like a particular driver of this association with hypertension. And it seems that the police stops did have the most strong and like the largest magnitude of an association with higher rates of hypertension and high blood pressure. Some limitations, there are always limitations to an epidemiological study. The cross-sectional nature of this analysis means that we can't really make any inferences about causality. I can't say that experiencing discrimination causes hypertension, though in the future we would love to include longitudinal data to sort of get at causality a little bit more. A limitation of the tool is that you could only cite one primary reason for experiencing discrimination. It makes discussion of intersectionality difficult. So for example, queer people of color, if they experience a lot of discrimination due to their sexuality or their gender, and they feel that more keenly, even if they were to experience racial discrimination, it may not be cited here. And again, the same limitation that I state, which is that interpersonal racism rather than structural racism was measured, and we're interested in analyses that account for or look at structural racism in the future. So my conclusion overall is that experiences of racial discrimination are associated with higher odds of lifetime hypertension in this survey. And this is a particular issue for our Bostonians of color because there's just simply a higher likelihood of experiencing racism in those groups. Hypertension is associated with other adverse health outcomes, and addressing it at the root is important to prevent those outcomes. And this analysis contributes to a body of literature showing that there are quantifiable negative health effects associated with being the target of racism. So these are my references. Thank you so much.
Thank you.
Thank you for that. I certainly don't disagree that incidents of racism and whether or not they're, something that might be one larger one or things that are ongoing in a person's life have negative health impacts. But I am curious why there wasn't a question about experiencing racism in a healthcare or medical facility, in a clinical setting.
That's a really good question, and I think that that's one. We are currently in the process of designing the breakfast for every other year, so it's 2023, so the last one was 2021. We will be conducting the breakfast again this year. And I feel really lucky that we're having this conversation now because as I don't believe that survey has gone out yet, and our group has a hand in creating the survey. I think it would be fantastic to add a question about discrimination in a healthcare setting specifically, particularly given that we as Boston Public Health Commission have ties to a lot of the healthcare providers in the city. As to why it wasn't included in the first place, I'm not exactly sure. I do know that the two questions about experiencing threats and harassment on the street and experiencing worse services in restaurants and stores were adapted from a scale made by someone at Harvard named Dr. David Williams. So it's possible why these two were chosen. I'm not sure if the original scale has a question about healthcare on it, and even if it does, I'm not sure why these were chosen in particular. The preface, I think, is aiming for a certain length. I want to say a half hour, but I could be making that up. And so at the time that those were just determined to be the best indicators, or what was most of interest at the time that preface was created. But I really take your point, and I'm going to bring this up at our next team meeting.
Adding to that, not to make any survey longer, but I think these things are really important when you're, as communities of color, looking for research that supports our grant making in particular. Discrimination in securing housing. We all know that Boston has had a terrible history. Just to shortly put it, around housing discrimination and continues to. And I also think racism in test taking, since this particular city is so heavy on the tests that we expose our children to. But things like that I think are really important, and I feel like can also make it more worthwhile when people in the community are actually responding to these types of questions. Because if they don't see that a survey design is truly designed to capture their experience, or even try, to be honest, to capture their experiences that are always intersectional, because we are intersectional, then I think it makes it really hard to encourage survey taking.
There was a point I attended the session this morning on housing, and someone made the point that when they were designing their instrument of asking, I think it was about tenants and access to rent assistance, that they were also similarly, as we are doing, trying to make their instrument shorter because they didn't want to waste their participants' time. But she mentioned that once they got on these subjects that were really near and dear to the tenant's heart, that it almost felt like there should have been more time allotted, that they were willing to give their time when it was an issue that affected them. So I think that that's something that we can consider as well. Like, yes, it's good to be brief, but it's maybe it's not the burden that we think for our research subjects and for our partners in the community to be able to give their time back if it's something that they care about and that affects their lives.
Right, and don't know where we are in time, but I do also want to throw in that I noticed very much that all three presentations lacked data on Native American communities, and particularly, I tend to expect that more with national data. I do tend to expect that more as well with data relating to other ethnicities or races, however, whatever those are. But again, Native people are intersectional. That was something that was missing from the earlier presentation, and in this one too. And I think it further erases not only our experiences but our actual personhood. And for an agency like mine that administers a number of social services, it makes it very difficult to work with public health institutions. And I'll just say right now, as the executive director of my organization, I have had problems working with the Boston Public Health Commission, and I really would like to see that change. And I think other communities want to see that, and I think people who have intersectional, mixed race heritage want to see that out of our public institutions as well.
Yeah, no, the point is well taken. Trust me, I am hearing what you're saying now.
Well, with that, and I think we're going to invite the gentleman to join us on stage, and we can kind of pick up from there a little bit. Nicola, I'll invite you to sit here and bring your chairs. But thank you so much for that presentation, Nicola. And you can stay. So we'll kind of, and I want you all to be, I'll stay up here. Be bringing up your questions. We have some folks in the audience that are here that can bring you a microphone. So if you have a question, raise your hand now, and the microphone will come over to you. I do want to give the gentleman just a chance to respond to Raquel on just that idea of native data and erasure. I'm going to give you this since I have this mic. I don't need two mics.
Okay. No, that's a really well thought out question, and it's something we have struggled with at Indicators as well. One of our earlier reports, Changing Faces of Greater Boston, actually worked with the Canal Institute's center there on an entire chapter on what data we do have about Indigenous populations here in Boston and in Greater Boston. And while we don't explicitly call it out, when we are mentioning, with our definition of Black in this paper, we are including anyone who selects Black and white, Black and Asian, Black and Native American. Those are fully a part of that population as well. That's kind of where we are on that particular subject matter, but I do understand where you're coming from, and it's something we'll probably revisit in the future.
I actually had data on neighborhood opportunity by race that included.
that.
Yeah, I'm sorry, it fell victim to the 10 minutes. I would have at least mentioned it then, but if you look at we have a map app, where you can overlay the racial ethnic children, number of children by race, ethnicity, and sort of in what types of areas they locate, what neighborhoods they're located in. And certainly Native American children are included as a separate category. So you see these fairly extreme inequalities, especially in sort of rural areas in the Midwest or Southern US. Like from the perspective of a survey researcher, right? If you have money, right, for 3,000 interviews per year, there is just, I think, limitations in sample size unless you, massively increase the amount of money spent that people asked. I think that's the only way really to get at these more granular identities or smaller groups in the data. I don't think there's another solution there necessarily. So you have to do a census or something like this. I'm not sure what the willingness is there, but I think it's fundamentally a question of funding.
Raquel, do you want to wrap with any other themes or feedback or comments, just, from hearing this progression of these three reports today?
I will just briefly add that at the start of the pandemic, my organization was contacted by the Massachusetts Department of Public Health, and I participated in a data equity committee. And it took from April to December 31st of 2020 for the state to publish any data on the American Indian community and the impact that we faced by COVID. And the original answer that I received was sort of similar, that the sample size was just too small, there were issues of privacy, and it actually, I want to say, I give a lot of credit to our friends in the disabilities community and in the Pacific Islander community to have been so outspoken with me during that process with the state to really push their data folks to do that disaggregation and to publish that work and to talk about why it was meaningful. And one of the outcomes was that not only, having the information finally available, but it also prompted the Department of Public Health Massachusetts Department of Public Health to do a follow-up survey, with only the American Indian community, and to actually do the work of finding not only an organization like mine, but finding the departments within the tribal health departments that are here in the state, and any other organizations that typically serve Indigenous peoples to really take the time, and they resourced us, which is key, to be able to have staff time to sit with people in community and to talk about why it was important to participate in this type of survey. And only after all of that work did we have something that was real and tangible, and then gave the state the opportunity to say, oh, look at that, there really was a huge impact, and we would have never known.
Wow.
Wow,
no, thank you for raising that and sharing that, because that's just a real example. It was going to be part of Jonathan's presentation. I think he couldn't make it today, but I like how he had it in his literature. If you can't track race, we can't track racism. And when we track racism, we can counteract it. And the collection of reporting racial and ethnic demographic data can illuminate how this racism manifests and also inform how we attack it with policy, with resources. So I think that's a really, thank you for making that point. And I know we have one question in the audience, and I want to get to questions. And please, if there are others, we have, I think, 2 microphones, maybe. But please, and if you would, please introduce yourself as well before you give your question.
Thank you. Wonderful presentations and excellent provocateuring as well in response. My question's for Peter, and I wanted to push a little on to ask you to clarify a point around the census. I saw that Shirley, Massachusetts has a slightly larger Black population by the data, and I'm curious how much the role of prisons plays in that. Sousa Baranowski, Shirley Medium, Shirley Minimum are all in Shirley, and it's a total population of I think Shirley has 7,500 population. In between those prisons, there's at least 2,000 people that are disproportionately Black. And so I don't know if census data captures people who are incarcerated, where they're incarcerated, or where they're from. They often get lost in that storytelling. And obviously with enormous consequences for where resources go. So I'm curious if you know the answer to that.
Sure. Yeah, that's actually a really good question because it's been very complicated as the census has tried to figure that out. What we are measuring in that map that you saw earlier is households, which are distinct from congregate care settings such as prisons and dormitories and things of that nature. So we aren't capturing, I believe that was households. So I do not think we were actually capturing, no, that's not true. We were capturing those prisons as well because we're looking at population share. So yes, we do capture that a bit, and they are included towards the population total there.
And I don't know, it sounds like you're getting at with your question kind of a why is that, or should we not?
Well, I guess I do research on that, but what that means is then resources are going to care for a population that doesn't live in the town. It lives within a geographic jurisdiction, and the families bear the burden of communications, of travel, of engagement, right, of the entire work of maintaining relationships. So it's a group that needs to be, I think, attended to very closely, especially, I mean, like I said, Shirley's like 7,500 total population. Between the prisons, it's probably at least 2,000, and that's today, when the numbers are considerably lower. Over time, I wonder what the impacts on mass incarceration during those decades would be on the Black population in Boston versus some of the outlying, Shirley's in particular, because it concentrates prisons.
Yeah. No, I wish I had more in-depth answer for you, but it's, you know, I really know kind of a little bit of the data necessarily, but there is so much nuance and there is so much back and forth about how to count prison populations on many different sides of the angles, but, you know, especially with regards to politics and district identities and boundaries and things like that, that, to be totally honest, is really beyond my ken.
Thank you for that. Next question?
Hi, I'm Alex Curley with the National Initiative on Mixed Income Communities at Case Western Reserve. Great presentation, super interesting. Nikki, I had a question. I'm really interested in the mechanisms through which discrimination experiences lead to hypertension and the cumulative effect. And I was curious if you had questions about, I think it's called the hypervigilance scale. And it's questions around like, you know, do you change the way you go about your daily life, or the routes you take through your community based on racial discrimination experiences? I think it's a series of questions like that. But.
Totally. If I had to speak at mechanism, I would probably say that we don't know, but our hypothesis, or my hypothesis, my personal hypothesis, would have to do with discrimination in any sense. Obviously, threats and harassment are horrible, but any just like extended exposure to like even microaggressions such as worse service in stores is stressful on a person. And like you said, hypervigilance is something that would increase cortisol levels in the blood. I'm not a medical researcher, but I would suspect that something like extended stress would be just like wreak havoc, not only on mental health, but also on physical health as well. So that's my hypothesis for mechanism, but definitely more research needs to be put in to why that might be. Although I would also say that, like, even if we like knew the mechanism by which it worked, it doesn't matter when the solution is that we should reduce the amount of racial discrimination in the population at large. In terms of questions about how one might react to being discriminated against or something like hypervigilance, like you mentioned, I would answer that it's not in the survey as it stands, but a big project of our team is that we are really hoping to do a set of follow-on surveys with some of the people that responded to, I don't know which wave, but a previous wave. Like I said, this has always been cross-sectional, so you get surveyed once, you're done. But there's so much power in being able to go back to the same population and ask them follow-up questions of again, things that are of interest to us, things that that they think are important that they didn't get to tell us the first time. I don't know the status of that project, but it's a real big desire of mine, and I'd love to go back and ask some of these questions, particularly surrounding these, considering the set of questions we ask are so limited.
Thank you for that. Next, take this up front and then in the back. Thank you.
Hi. Thank you so much, all of you, for presenting. I had a question. Oh, yeah. My name is Bilgisa. I'm the program manager at Northeastern ACEDR, which is the Community Engaged Teaching and Research. I had a question for Peter. I'm wondering about the impact of the work that you presented and the data that your team is collecting, more specifically around if you guys have studied recent trends around like the housing crisis kind of in Boston, particularly thinking about the redevelopment of a lot of the neighborhoods like Roxbury, Dorchester. Obviously, one of the data that you showed up there spoke about, the disparity between Black people in Boston who owned houses versus white residents here. And obviously a part of that was the red line zoning that was going on in the past. But recently, these redevelopment projects have also been, a way that has taken a lot of the residents that were living in the inner cities to like the outside, particularly even you spoke about Brockton, being heavily populated by Black residents. I guess I'm just wondering about the connection between what, if you found recently, like in recent years, that has been like a trend that's happening, and then to take it one step further, what is your team, in a way, what's the impact of the work that you are doing with the data collecting? If that makes sense.
Thank you. Yeah, no, that is a very good question and things that we think about a lot. The map I showed of Boston is actually shared population by census tract that identifies Black, but in the report, we actually do a percentage point change in the Black population rather than like a share, which is just a kind of a better way to present data in a presentation. And in that, we actually do see like a significant decline in the share of the Black population in Roxbury Roxbury census tracts of parts of Dorchester. Roxbury in particular saw multiple census tracts, and that is a smaller geographic unit of reference, dropping of over 7 percentage points across a number of Roxbury tracts, some in Dorchester as well. And the interesting thing about that is even as the Black population grows, it's just been growth in other populations moving into those census tracts has been such that the population share has declined. And we didn't track, and it's not something we can really track in census data and American Community Survey data, where people are going. Like, I can't follow a household in Roxbury and see where they go. We can maybe see that they move to Plymouth County, or they move to Middlesex County or something like that. But even then, that gets a little dicey. But certainly the Globe, the Boston Globe, has done a lot of reporting on the subject. And we see a lot of trends, and they find people and they talk to people who are like, I've been pushed out by housing cost. I've been, I want a better school for my kid, or any number of things. And that kind of anecdotal data, or that kind of anecdata, while maybe not necessarily the kind of stuff you'd present at an academic conference, is super important. And it does help kind of craft a narrative of what is happening here in Boston, in greater Boston. But the very specifics of like, where are people going? I can tell you, the Black population share of Boston census tracts in some census tracts has declined, and Brockton's Black population share has increased. But I can't tie it to neighborhoods, and I can't tie it to individual communities. There's a strong suggestion, and kind of maybe there's more private data that shows that, but not in kind of national data sets like of the type that we use.
Okay, thank you for that question. Ma'am, in the back there?
Thank you. Can you hear me?
Yes.
Excellent. Good afternoon, everyone. I'm Georgia Simpson. I'm the Regional Minority Health Analyst in the Office of the Assistant Secretary for Health in Region 1, so I cover the 6 New England states. This question is probably for the hypertension and racism study, and I am very familiar with the BRFSS and some of the limitations. I also previously worked at the Massachusetts Department of Public Health, where we used, of course, that information quite a bit. And just wondering, given how the method by which that survey is administered to the public, do you still have challenges relating to capturing data from individuals with limited English proficiency? And how are you overcoming that particular barrier?
That's a great question, and something that I wish that my collaborators were here for as people who are more strongly tied to this. I do believe that the preface is administered in Spanish, but I'm not sure. Thanks, Neil. But I'm not sure about other languages. One change that we are interested in making, and I think that this is going to be included into this year's survey, is that historically, as you must know, it was been a phone survey, which is hard even for people who are completely fluent in English to get all of the nuances. I think that this year we're going to be doing some administration of the survey, not via phone, but online, such that people will receive a link somehow. I'm not sure if it's via email or if they'll receive a letter with a URL in it to conduct the survey online. I'm not sure about language flexibility there. Historically, English and Spanish have been included. I believe Mandarin and Chinese as well, but I'm not sure. But at the very least, there will be less immediacy in having an online, not a requirement, but an online option. Hopefully that will allow people to have more time to understand. Of course, with a written component, this adds an added complication. But I think that the way that my team feels is that the more options people have to respond, the better, just because people will be most honest when they feel most comfortable answering. But I acknowledge the limitation.
Thank you. Oh, follow-up question here. We'll bring you a mic and let us know your name.
I'm not a researcher. Hi, my name's Stacy Chacker from Health Resources in Action. And I just think you would obviously have to have the resources for this, but what about in person with trusted partners to have people coming in where they're going to anyway to be able to answer questions in their own language with someone that's a trusted partner? And it could be an investment by the Boston Public Health Commission in funding some CBOs to do that kind of engagement.
Absolutely. I think that the more, what I've come to realize, and I've been working at the Boston Public Health Commission for a little over a year now, and what I've realized is that there are so many rich community organizations in our city that we could really benefit from collaborating with more closely, as you've suggested. Not only because they're resourced in ways that it's not that we lack resources, but that our resources are tied to other projects, but more that they just have the history, long histories and ties to their neighborhood and the actual residents of the city. So yes, I definitely appreciate the suggestion, and I will pass it along.
Yeah, thank you for that. Identifying solutions right here. And I want to give, we're almost at time. I want to give everyone one last, what do you want to leave everybody here with? Or how to reach you? You just have a moment here. But I will give a plug, a shameless plug for The Emancipator. If you please follow us on all the socials, _Emancipator, theemancipator.org to read our stories. We're actually hosting a solutions circle for new and expecting moms, centered around breastfeeding, because Black mothers breastfeed at a rate of, I think, 17%. We have these numbers, 17% less than white mothers. And they come in with the same intentions. And so why is that? We've been working with some researchers at BMC, and they're also affiliated with the Center for Anti-Racist Research, to literally ask, are you facing racism in the hospital, in the delivery room? How were you treated? How did you feel? What did a practitioner say to you? How did you interpret that? Did you get the support you needed? And really ask these direct questions related to breastfeeding, because life expectancy of the infant and just the health outcomes for the mothers are just improved greatly if they're able to breastfeed. So we're taking this time, May 6th, in Roxbury neighborhood at the Nubian Gallery, to have a solution circle. If you go to our Twitter and our Instagram, you'll see there's an Eventbrite page to sign up. You can say hi to me. My colleague Crystal's in the front row. My colleague Alex is here too. And that's just going to be our way of actually meeting with and listening to. It's a time for us to say who we are and what we're doing, but it's a time for us to listen to these communities so that we can reflect back to them. Oh, and we do have one more question before we have our last round of sign-offs from the panelists. Thank you.
Yes, hello everyone. My name is Joseph Edgecombe. I'm an organizational activist. I have several different projects I'm working on. Something I noticed is many things I noticed, in particular, the Diversity Kids information that was there. One indicator that you had on the board was opportunity to white collar professions, and I would consider that non-political, suit wearing or white collar professions, because there was many politicians all over the TV every day and running around getting exposure. But what we used to call white collar professions, and now we use STEM and STEAM professions, engineering, math, science, and typically it would be those type of fields that we're trying to advance kids from underprivileged communities or compromised communities to advance into white collar professions. And in the past, it's been tokenism, token people that are taken, and there's one person in their company. So we're trying to break that model, and I was wondering, from the data that you're putting together, how can you emphasize those aspects of advancing? That's going to bring economic advancement to Black and brown communities, or what I would call to Black X. Latinx is not something that could be, because mixed Black communities are Native Americans as well, from the history of the country, from the history of abolition, the history of slavery. So Blacks and Native American have a connection that other races don't. But what I'm trying to ask is that we need more emphasis into those areas and more exposure of those individuals, and not to individualize them, but have that understanding that they're a greater part of the community that might not be exposed. And how could we emphasize the advancement of those figures. That would be different organizations and societies throughout the country who have college kids that are going into these professions. And then we have to extrapolate that data from those engineering and various organizations and find out how many, and what are the problems in those fields, from graduating high school into getting involved in profession and trying to become a role model for your community. So that's what that would be about.
So it's how do we translate this data into opportunities for advancement, for kind of pushing towards career advancement, really, and community advancement? Yep. I think that's a question that anybody could take. Does anyone have I know you're data scientists, but does anyone want to speak to that or try to address that one?
I mean, you mentioned our data, and
Yeah.
I mean, first of all, I 100% agree that there's still way too much underrepresentation of like non-white people in STEM fields. I mean, we see this ourselves when we hire for data analysts or data scientist positions. It's a very skewed pool still, and I think you have to start by investing in communities, start in schools. Just the only take I have from the work we do is that the index helps us maybe identify communities where we want to do more and build those bridges for kids. But specifically how, you increase engagement with STEM fields, I'm not an expert on.
Well,
Someone else.
and you can answer that, but we're at time. I just want to give everybody like 30 seconds. So Raquel, if you want to start, you can address that or anything else you want to address.
Totally related. My last words were going to be something to the effect of doing work that is actually impactful is really hard, and it's requires a lot of coalition building, a lot of community building, and a lot of grace to be able to work with people from different communities. Specifically speaking to the gentleman's point and question, I suppose, is related to when I asked earlier what type of opportunities are researchers making available to the communities that are being studied. And my point there is that there cannot be community solutions without us, and that it very much requires the conscious work of building pipelines and meaningful programs with meaningful pay that will bring people from the community into research fields and into all other fields, quite frankly, to be able to do the work of redesigning all of these surveys, all of these things that are published, and redesigning the systems that we have to live within.
Sorry. Okay, Nicola, what's your sign off?
Yeah, so my sign off is just that as the government worker on this panel here, I would say that I feel really grateful to be able to be in front of this room who's full of people who are thinking about this every day and these experts in the areas of racial justice. And my ask back to you is that we are always looking to establish community collaborations with the community. We have an office of community engagement. They're amazing. They do fabulous work. I haven't been able to get a meeting with them for a month and a half. So if I could use this opportunity to reach out and say, if any people think that they could give feedback on our work and what we do, my email should be somewhere in the program, and if not, I'll stick around for a little bit after. Thanks so much.
Thank you, Nicola. Comments? Last word?
Yep. Visit diversitydatakits.org. If you see something there that you like, please reach out. We've worked with people from across the country, and for us, this is some of the most rewarding and exciting work because that's ways that we can be useful in. So do reach out or come talk to me after the presentation. Thank you.
All right, and Peter, last word.
Sure, thank you. It is such a pleasure to be here, but I think the biggest takeaways from this report and a lot of the work that we do at Indicators is that it is so important to understand how kind of we identify ourselves and how to translate that into government surveys to better provide services and supports. And often there is a big disconnect between what we as researchers put down on paper versus how people identify and put down on their own paper. And trying to bridge that gap is an ongoing question and problem, and something we try to tackle every day.
Well, thank you for that. Thank you all for your work. And let's thank them. Let's just give them a big round of applause. Thank you all so much.
Llama. Teacher trick. Yeah, we did it. We did it. Okay. I don't know. My answer to this teacher trick was always this. Hi everybody. My name is Kim Lucas. I am a professor of the practice. I don't even know my title. I am a professor of the practice of public policy and economic justice at the School of Public Policy and Urban Affairs at Northeastern University. Ooh, I am also the associate director for civic research at the Boston Area Research Initiative, which hopefully you've heard of by now. Hi everybody. This is, as you can see from the lineup in front of you, a jam-packed session. You are here, hopefully, to learn about innovations in approach, whatever that means. But we're here to tell you, and we're here to talk about this. And I think maybe most importantly, despite the lecture style of this room, we are here to have conversation with you. So here's how it's going to go. I am going to kick us off. We're going to do a little bit of framing of what this is, at least from the BARI perspective of how we conceived of this panel. I'm going to have everybody here just briefly introduce themselves, their names, their titles, their organizations that they're coming from. Every panelist will have about 10 minutes to share their work with you. And then our lovely friend, Chris Osgood, will step in as a provocateur, which hopefully you've experienced. We'll see how it goes. And then, as this panel has conceived of it, we are going to do a little bit of a reverse Q&A. They will ask you questions. So get ready to talk about your own innovations and approach, but also get ready to think about questions you have for these folks that you want to talk to them about after this panel is done. There will be a coffee break, so you can flag them down. I'm not going to say more because we have lots to do and I am not the star of this show. I have introduced myself. If you all want to introduce yourself, maybe just go down the line. And I have been told, and this is for everybody since we're all going to be talking, that it will be helpful for the live stream folks if we all talk into a microphone. So I'm going to shuttle microphones. That's my job, and also keep time. But maybe we start here.
Hi, I'm Jonathan Fanning, he, him. I am an educator at the Museum of Science.
Hi, I'm Michael Amole, he, him. I'm an undergrad studying environmental science public policy at Harvard.
Hi, I'm Angela Zhang, she, they, also undergrad ESPP at Harvard. Awesome. Okay, so innovations and approach. As BARI conceived of this panel, you are going to hear 4 different flavors of like, well, we're doing very, very different things. And we wanted to not focus on a specific subject area like you may have seen at some of the other panels, but rather think about how
we do what we do, and really examining like, how did we get there? What does that mean? Why did we do things that way? We'll all touch on a little bit of this, right? Okay, so I'm not gonna, this is like a teaser now. I'm gonna hand it over to Maddie to kick us off. And there you go. Yay. Okay. So now I want you to all think about what would you do if you were the city and this was your issue because it's real. And hold on to that because we're going to do a reverse Q&A. I don't know if anyone's mentioned that. Jonathan and crew, I think I'll hand this over to you all. Thank you. Okay, as Min comes up and sets up, okay, challenge to everybody out here. What might it look like? What might it take for you all in your own work to bring in expertise from the outside? What would you need to set up? What would you need to do to make sure that additional expertise, we often talk about like building capacity, growing capacity. What would it look like for you to actually do that? To bring in folks who don't do what you do and maybe think differently about the issues that you're working on than you might. Um, think about it. Reverse Q&A, FYI, at the end of this. Ooh, yay, I didn't come up with a question for this one. That was good. Okay, we are more than midway through the presentation part, but here I am with an intermission. This is a quiet intermission. It's not a get up and be loud intermission. So quietly. Oh yeah, there we go. Good job, everyone, with that part. I just want you to look around and lock eyes with someone in this room who you don't know. Lock eyes. Go. It's a little weird, but I'm directing you to, so that's okay. Okay, lock eyes. Have we locked eyes? I'm shifting my eyes so no one can lock eyes with me. Okay. And hopefully after this session, maybe over coffee and a snack, you might find this person who you now have locked eyes with. And you might introduce yourself. Totally okay, sanctioned by me. This is a conference. It's called networking. Okay. Okay. Very good. Okay. Now we're going to hand it over to Nathan and Matt.
Maple collaboration. Created by the New Law Lab at Northeastern University Law School. And the challenge that we're trying to solve is that right now in Massachusetts, if you do want to have your voice heard in the legislature, it's not easy. The processes that we as a state use to converse with constituents to submit testimony are often arcane. It can be confusing to know how you submit testimony on a bill, how you share with your representatives, how you feel about an issue. And as a result, a lot of vulnerable communities feel excluded from that conversation. We're trying to solve that problem. So we're doing that through three primary strategies. One, trying to be very accessible. We're trying to standardize and demystify the process for submitting legislation. And we'll talk about later, we're also trying to build tools that help people who are not native English speakers interact with the legislature that operates entirely in English. We're also trying to promote engagement. We're trying to get more people involved in the legislative process by making it easier and by helping everyone to come together, lawmakers, residents, organizations, and issues to have a prolonged focus on issues together. Okay, so I'm not going to talk anymore. I'm going to hand over to Matt. We're going to do an actual demo of the website. And for anyone who has a laptop or a phone, please go to mapletestimony.org. You can follow along yourself.
Hi everyone, so this is our website. Let's get the website. We have more storing and searching features. So that hopefully allow you to find the bills related to find the bills that you're interested in. So I just have to share something, curious if there's something on here related. Website and share her perspective and thoughts on this. Currently, you sort of only have social media as an outlet. Twitter can be sort of good and bad. It can be shouting into the wind, but certainly the things you tweet aren't tagged to a particular page where everyone can see all of these thoughts at the same time tied to one piece of pending legislation that will or won't pass. So that's the bill page. We also have profile pages for bills and, I'm sorry, for organizations and people. So this is my profile. So here you'll be able to see any testimony that I post. So you can see different organizations that you're involved with, create a profile. You can see all the testimony that they've posted. We're working on rolling out a social layer so that you can follow organizations and people that are interesting to you and get notified when they post testimony. You can follow bills. You get notified when those bills have hearings or when they're moved through the legislative process and are scheduled for a vote. That's the basics. I was gonna do one more thing on creating testimony, although I'm not logged in, so it's a little bit of subscribe. Yeah, so to create testimony, it's simple. You create your profile, it's free to use. You find a bill that you're interested in. You select whether you endorse or oppose the bill, write your testimony, and when you publish it, it will simultaneously publish it on our website, on the archive, and also open up your email client, Outlook, or whatever you use, and populate an email with the testimony that you provided, addressed to the correct legislators for you to send that testimony to, or it to be formal testimony in the legislative process. So with a few clicks, you are sharing your thoughts with your community, and also sharing it formally with the people that can act on your behalf.
Perfect. So the thing that doesn't exist anywhere else prior to Maple launching this a few weeks ago is this testimony section. The state does not make available testimonies to the legislature. There's no other service that's collecting information about public opinion like this. So we're so excited. We've just launched this platform, and now we're starting to see people join it, share their testimony, so we can get a census of public opinion on important bills. So let me continue. Okay. As Matt mentioned, we're trying to provide a space that's different from something like Twitter. Different from social media for sharing testimony and having your voice heard. We are a moderated space. We have a code of conduct that will strictly limit trolling. We do not provide a comment section where people go back and forth and swap thoughts with each other. It's really for you to be able to share your voice, let it stand alone, alongside other people's voices as well, but not directly in dialogue. We're providing a public archive of testimony. When you use our site, you're choosing to opt in to share with the broader public, and you're also submitting a record to the legislature, so your voice is included in the committee process around the bill. We provide limited functionality for deleting and editing that testimony for that reason. And we're a platform that really values sincerity over performance. We don't have follower counts next to individual or testimony. We don't have upvotes on testimony. We want different voices to be shared, but we don't want to incentivize people to have the loudest or most bombastic voice on the platform. We're promoting a shared reality, a shared understanding. If you go to Twitter, if you follow a certain set of people, you're going to see their views. You're following them maybe because they're your own views. And so you see something very different than maybe your uncle who's on the opposite side of the political spectrum. When you come to Maple, you have access to the full range of testimony. You can see what everyone is saying about an issue. We hope, because we're here at BARI, we hope this will be a truly valuable tool for researchers. It's going to be it is now the first archive of public testimony available in Massachusetts legislation. So if you're an advocate, we hope it's a great space to connect with other advocates in your area, no matter what side of the issue that they're on. You can come together in a shared space now. You can learn from other people's perspectives on a bill. If you're a researcher, if you're interested in studying public opinion on important issues, if you're interested in tracking over time or across space in Massachusetts, this is an open source data set that's available to be used. And if you're a journalist, if you're reporting on an issue or a bill, if you want to survey public opinion, see what people are saying, maybe find sources, we hope it'll be a very useful platform for you as well. So we have a lot more to do. We've really just started building out this platform. We've just launched it publicly. Over the next few weeks, very soon, as Matt mentioned, we're rolling out features for you to be able to follow organizations so you can hear their latest testimony, learn about their perspectives, get email updates on that. Over the summer, over the next few months, we want to roll out those translation features I mentioned, so that if you're not maybe an English speaker, you can use machine translation tools that help you have your voice heard in the legislature. We're also integrating state lobbying records, so alongside what organizations and people are saying, we can also see what paid lobbyists are saying in the legislature. In the next vendor, we want to integrate media mention. We want to automatically pull in reporting on bills so that can show up. Those journalistic sources can show up alongside public testimony. We want to integrate legislators' voting records, what happened to these bills at the end of the session. So I'll leave you with this thought. There are lots of ways to get involved. If you're an advocate, we hope you'll use our platform. You go to mapletestimony.org today. You can start sharing your thoughts. Organizations you're involved with can do the same. If you're a researcher or a journalist, try our site, look for testimony, see what people are saying on issues that you work on. If you engage with communities like so many organizations who are here at BARI do, could this be a platform to help your constituents and projects you work on have a larger voice? And if you're a data scientist, we'd love to work with you. If you're a developer, we'd love to work with you. If you're a designer, we have this great team that's come together through Code for Boston, and you can learn what we're doing. You can write to us at info@mapletestimony. So I'll leave it there. Thank you all very much for having us today.
Awesome. I guess the big question for me with this is like, how do we use our tools of research, data, design, technology in ways that are win-win-wins, right? Like, look at all the different kinds of people you're inviting to use this and to be part of this. Like, that's a win-win-win. And what does that look like, right, in our own work? I'm going to hand this over to the great Chris Osgood.
Yeah, thank you so much. So I'm serving the role of discussant or provocateur. And so I heard that you remember this, but I don't know what that means. That's a way of my job is to step back for a moment and try to find a through line across a series of awesome presentations that I just heard. And a through line across them that connects back to sort of the theme of this panel, which is how we think about innovations and approach in our world of civic research, in our world of civic innovation. And what that means, frankly, the community that exists in this room, in this conference, or in this region, sort of focus on this world. And I think, like, overwhelmingly, like, listening to this awesome group, like this is a community that is incredibly strong, that is absolutely evolving, and it's like unifying in all the ways. So just to dive into those briefly, first on the notion of strength. I think it's super cool that we have heard from a local government, a leading cultural institution, a research and evaluation firm, and a set of civic tech entrepreneurs. We've heard from folks like Jonathan who are thinking about how you use this technology for, how you use this work for education and Maddie think about what this means for policy and program development. from Min about how this is actually used for culture building and evaluation, and from Nathan and Matt about what this means for habits. We're doing it across a whole set of sort of different policy areas that from Angela and Michael and Coach, we heard about how this work is thinking about decarbonizing Boston and conformity, Boston recommendation. Those groups, obviously about how we're thinking about advocacy in Beacon Hill, to how we're thinking about the literal sidewalks in the city of Boston, to Min's work on how we're thinking about culture within our own organizations and reflections within ourselves for how we think this. And I think that diversity across organization, that diversity across scale, problem we're taking on, that diversity across approach throughout civic research, I think totally points to how strong this community is and how relevant the work is that they're all doing as an approach to tackle the biggest challenges. I also think in a very good way, this work is evolving significantly. My point of departure here is to think about the BARI conference. The first one was probably 10 years ago, or maybe more than 10 years ago. And I think it is unfortunate to say that 10 years ago, this panel would not have happened. They're all so much better the fact that this panel did happen instead. And the sort of conversations that we're having in this space really have sort of, I think, moved us a different way. This is where I'm going to, I don't know again what it means to be a doctor. So we're taking a little bit of distance. To create things that are like underthought and overstated. So sort of like those are. And I think about the nature of the way in which it's works. And the first is this idea that the era of big data is dead. That there was a point in time in the world of civic research and civic tech where the engagement, at least on the city side, looked a little bit like this. Give us all your data, we will give you all the answers. And if you do not have thousands and thousands and thousands of rows of data, we are actually not interested in the conversation. I think while there is still a huge amount of value to be learned from very large data sets and from mining large data sets, and we think about all the great lessons that we learn from great data sets, I think what we have heard is the incredible value of like small data, of intentionally built, of data about what happens sort of beneath a specific part of a specific law or a specific piece of public legislation that have been necessarily. That small intentionally built data is as valuable as that data. The second sort of like underthought, overstated notion, I hate that, Brian. That also kind of be with part of this, which is, you know, I think that the fact is we don't have all the data we need, and that is a wonderful thing. It is actually a great thing to not have the data, to not be able to start with it. That I think what you have seen over and over again from this panel is that like, if you don't have the data, then it actually forces you to have conversations. It forces you to have conversations about who are the experts, who actually might have that data. How do you actually do that outreach together to collect that information in the first place? And I think by being comfortable with being able to sort of start with issue areas where we aren't data rich, we are actually focusing on more of the priorities of the needs. Within city government, it's as Dan and I were reflecting, not long ago, 12 hours ago. So much of like the focus on data collection in city government sort of built around a notion that actually sort of believe was sort of Peter Drucker sort of managing itself. That if you can measure, you can. And I think that is actually, there's a lot of truth in that and a lot of value about how you actually provide good data to be able to better. I think that's a very, but I think that also can evolve to an idea that you only manage what you measure. And when you only manage what you measure, you actually end up cutting off all sorts of things, or only measure easily, but as David pointed out to me, you cut off all sorts of incredibly important research areas, policy areas, sort of like things that we need to dive into. And I think that comfort that we've seen and practice that we've seen from all sorts of platforms that create new data between the public and for example, it's an immensely valuable part of the ecosystem. The third quick thing, and this is sort of perhaps more obvious, is that I think you see in all of these presentations that equity is an established priority, but it is not yet an established practice. That it is that every single one of these presentations is thinking about how we build that more equitable region that we all want, the more equitable society that we all want. But I don't think that we should at all say that just because we've heard 4 inspiring talks about that work, that we should assume that that is a given in all the research practice or all the work that we do, and that we need to be as intentional as these groups are in thinking about that in our own work, lest we sort of fail to live up to the law. The final thing that I want to sort of think about, reflect on, discuss the provocateur, is this notion of unify. And this is the part that I was trying to do some live notes. I apologize if where it was wrong, but I feel like, again, turn back the clock. In previous panel around civic research may have just been focused on, I did this and this is the answer. And I think answers are really important. But I think what you've heard over and over again, the fact that we did something, we created a connection. And that is immensely important. You have Maddie talking about sort of using oral histories in neighborhood walks and works and conversations between our public works and special services department. Figure out how we think about responding to the airway outcome. You have Jonathan talking about how we're not just thinking about being a content provider, but a platform provider. And Angela's point about how this has been sort of a way to connect with mentors and group. And then the 52 contact piece is awesome, and I think so the reflection practices make established practices that allow us to actually connect with each other so that we can do this work a little bit better. And obviously, that's the work that Nathan and Matt have done to actually really think about creating new platforming space to create that connection between public official and people. And I think, with Dan here now over in the corner of the room, thinking about sort of the mission of BARD, a group which is intentionally created to pursue civic research that leverages data across this greater community so that we can advance social, economic, and environmental justice. So think about that as sort of the intent. Now, we're not going to be able to do that just by doing research. We're going to do that by building a community that's capable. And I think the most awesome thing that I've taken away from is that focus on practices that unify us, that allow us to be able to build not just the right research answers, but really be able to actually respond. So that was my quick summation, and hopefully that works as a discussion. Now ask questions.
Wow. Chris, dropping the mic as always. Thank you so much. I thought that was more than what I was hoping for. That's great. That's great. You did a great job. You all did a great job. Lovely. And now it's your turn to do a great job. But before we do the reverse Q&A, I don't know if anyone's mentioned. I would like for you all to do one more, again, silent activity. It's going to be a twofer this time. So I would love for you to pick a new person silently to lock eyes with. Please go forth, lock eyes. New person, lock eyes. Yes, good, good, good. And air high five. Air high five. Good, 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 good. Oh, good. Okay, we feel good. There's a little physical activity after lunch. The sugar's gone down. I hope that's given you all time to figure out questions to ask the audience. Does anybody from the panel want to ask the audience a question? Yes, Maddie.
Yes, sorry.
Oh. Microphone, please. Yes, there we go.
Yes, I asked it earlier, so hopefully you've had time to think about it. My question for you is, let's say we move away from the status quo of kind of turning the other way from these sidewalks that the city doesn't really have to take care of technically. Should we take ownership and start maybe even having to take, I'm not saying we're doing this, but like eminent domain style, like we're going to take over these sidewalks, we're going to close them and steward them? Or should we start enforcing the ordinance that exists that says that the property owners of the areaways have to maintain those sidewalks? It's a lot of money. That's right. Yes. I'm writing these down.
Do you want an A or B response or
something else?
Freestyle? Okay. Not real freestyle. The way the wind seems to be blowing in suburban Boston, aka Roslindale, is that people want the city to start plowing the sidewalks. So at least there's some walk advocates, ped advocates that want that. So this could be, in some ways, it seems congruent to say take over the sidewalks that the city everyone expects the city to be doing something with already.
Thank you, Rosladale.
I'm thinking about the care packages that you provided to the people you wanted your data from, and thinking you provide something to every business in Boston for offering up the information about the space that's under their building.
Back to the areaways. I think that you have the opportunity, if you want the city of Boston to take over maintenance, use that as a bounty for people to identify areaways, give them a time limit, and if they don't actually identify them, then they're stuck with it in some way. I mean, that would at least, get you 50, 68, maybe 80% of them.
Hi. So you specifically brought up Chinatown, which is an area that I worked on before I worked with the IOC. So something that I probably would say a more diplomatic way of approaching it is, so a lot of the businesses in Chinatown, they usually tend to switch ownership pretty often because, again, working with restaurants tends to be kind of a hard business to run. But a lot of those business owners in Chinatown don't speak English at all. So something that could potentially be offered is the city works with their other departments, so civic organizing, civic engagement, neighborhood liaisons. Those are really great ways of approaching these businesses who would not really care at all. It's like the biggest thing is to be able to communicate with them, speaking their language, literally. So I would say that the first approach, the diplomatic approach, is to make sure to contact, reach out to them, and making sure that they understand in their language that this is what's being done, this is what needs to happen. Maybe these business owners are not even aware of the areaway, since you mentioned that.
They're very aware.
They're very hard to identify. And you brought some of the pictures up and I was like, oh my God, I've been walking on those places pretty often. So yeah, so some of the first approaches is definitely extending basically a handshake, reaching out to these businesses directly, establishing those kind of connections with the community before doing anything, let's say eminent domain style kind of way.
Thank you. And also shout out to Chu, the ONS liaison for Chinatown, who is in contact with them all the time about this stuff, way more than I am. So thank you. And shout out to Chu for that.
Cool. Any other area ways? Oh.
Yes. We'll talk after.
Hi, I am also on the side of the city taking responsibility for maintenance, but I think two sort of more specific thoughts. I will admit to being a nerd in a room full of nerds, but I think I have never encountered anybody whose eyes don't light up with some sort of interest when you start to tell about like what areaways are and the history and all that stuff. And so I think the approach of like, here's a neat, weird thing about our city, and here's how we can work together to take care of it is maybe an effective framing and maybe more effective than the eminent domain framing, which I know you probably say mostly in jest. The other thing that I'll say is sort of seconding the suggestion of using ground penetrating radar. I had a family member who was able to locate a septic tank in a like summer camp in New Hampshire that nobody knew where it was because it was 100 years old, but they used ground penetrating radar and figured out where there's a thing under the ground, and that's how they know where it is now. So that would be a cool project to go walk around with a little sensor and map the underground.
I agree. Thank you.
If you want to find a story about this, Google Maddie's name and Streets Blog Mass, and there's a story about this.
Thank you.
Awesome. Okay, let's move on to any other questions that you have for the audience.
Yeah, I want to quickly bring it back to something that Angela said about entering sort of STEM fields and getting into this work, that it can be difficult when you are young to see a pathway forward or to see how your work might have value. And so I'm curious, beyond sort of like the internship model, are there ways that we can better scaffold the entry for youth into these different areas, or potentially think of different ways that we can validate their experiences as someone who is learning in the space, but also can actively provide very useful information in the moment to allow us to solve these sorts of large scale problems?
One of the weird things I do political campaigns and I'm doing right between people who do political campaigns and bureaucrats and then like there's got to be some there's a divide. There's a divide between people who come into this space like through an apprenticeship program, like city workers, versus like people coming out of into the
organizations. That's another great way for like students or people who are interested in the field to talk to people who are more experienced. We do like professional development webinars. So we actually like a few weeks ago had a student an event where we were just talking to students about like what is evaluation, what does it look like, so that they as undergrads or grad students can learn about what a future career could look like. So sometimes it doesn't have to be a high touch of like an internship program or something. It can just be like, hey, how do we get experienced people in the field to meet with people who are interested in that field and might interest in the field. I'm on the leadership team as well, so if that appeals to you, you can talk to me or you can talk to Min or bring in here. That's it.
What's it?
I love conferences. I think the conferences are super fun. But it's like, I find conferences a surprising way to bridge the academic to practice gap. I went to a conference when I was, so in college I studied aging, which is not a thing that a lot of people study in undergrad and not in my school. I was like the only person there that did it. But I went to a gerontology conference. I was going to school in Michigan, went to a gerontology conference in Boston. And it was crazy because I never talked to anyone in my building who studied aging, but I went to this conference with thousands of people who were working on it. And I was going to these sessions and people were working on stuff, and all of a sudden I saw the relevance of my work that I felt I had done in such isolation. And I got to see what this looks like in practice, the kinds of jobs people have, the kinds of places people work. And I got to walk around and say, hey, this is what I'm working on. What are you working on? And find out that we had this overlap, and then my work was actually respected when I was 21. And I got a job that way. And then I moved here, and then I'm going to conferences are great, and that kind of conference model where it's just an opportunity to see what your work looks like in practice and to see the overlap in what you might find to be some niche.
Second conference today.
Also, the food is usually great.
Excellent. With our hands back here for, no. Oh, behind you.
Also just wanted to connect that to the culture talk, which is something that we've been thinking about a lot at the city, and would love to connect with you later because our team has started a beautiful program for city workers to learn technical skills and say that like I think the answer is bringing more space within organizations to promote learning while already have all of the skills needed, but to have them and often in organizations, people think, oh, I need somebody who already knows all things in order to start doing the work immediately. When they could probably find a lot more people who are capable of learning, if you something about that space for learning, a model for everybody to learn something with nobody necessarily as the expert. So I think the data culture topic is particularly well stuff.
Okay. Does anybody on the panel have a burning question that they must ask this audience?
This amazing opportunity in the reverse Q&A, because the stories that I love that inspired so much of the Maple platform are when people are passionate about something and they want to make a difference. So I'd love to hear, does anyone in this incredibly civically minded group, do you have a story about something you wanted to change in your community? Did you reach out to a lawmaker? What happened in that conversation? What went well? What didn't go well? I would love to hear your stories.
Hi. So actually, it's really interesting. I was just at the State House on Friday last week talking with state policymakers because I'm part of a program at my school called Sophomore Serve, and we were studying food insecurity. And I know there's MassPerg who's working as well to try get a hunger-free college campus. So it was kind of, we're not affiliated with them at all, but it was kind of interesting to still pitch to policymakers like the research that we did. And we're hoping to actually go testify or do some sort of testification over the summer when they actually do the bill. So pretty cool experience.
That's awesome. We should talk. Maybe your testimony could be on Maple.
Anybody else want to share your experience? Okay. I can read a room. Oh, what? No, well, I can read a room, but I can also bring this over to you.
It's very nice of you, Kim. Thank you. I actually think one of the things that I'm really appreciating about Maple is having gone through and like helped pass legislation and worked on legislation in the past before we had even just a better functioning state legislature website. Like I had worked on the pay equity bill that passed in like 2016. I mean, you can applaud, but the data has shown that unfortunately we've all adapted to having more public information about salary transparency, and gender doesn't really matter in that conversation. We can talk about that later. But I mean, literally, we were able to like get that work done because the Massachusetts National Organization of Women Task Force, you know, we had a bunch of people who worked in the Patrick administration who knew exactly the legislators to go to and which chiefs of staff were effective. It took so much political capital and political knowledge to like get a major piece of legislation passed that we've all benefited from. And it's a great, I think, reminder to the rest of us, like Maple is a cool platform I just learned about today. Legislata is also like an incredible platform that a friend today told me about. Thanks, Greg. But I think it's like a great reminder that like we do these like incredible, like civically minded projects. A lot of us are really committed to political science in like the real and applied way. You know, and I think it's also very important that like you can become incredibly talented and effective in your particular realm of like civic service, public government, but it all touches each other. If you were in like the previous housing talk where in the keynote, you know, Gita had to raise over $1 million to test out universal basic income because we have an anti-aid amendment that, you know, is decades old. And so just thinking about those different pieces about like where are the intersections of where your work touches, and then finding the new ways to be able to take your advocacy, your energy, and your talent to that next space. So thank you for what you've built.
Okay, I promise to get you to your coffees on time because you have made eye contact with one or maybe two people. You've already air high-fived them. It's very awkward now. You don't know each other. I would first like to thank Barry for streaming us. To Toshi for bringing out all of the mics and making sure we are running well, actually, with all the AV and making sure this room is all well equipped. To all of our panelists and provocateur, I think you can step into that role, for sharing your work and asking provoking questions, and to all of you for participating. I know we didn't put this in the program that this was a participatory thing, but thank you for doing that. Yay, I know you have to run to your 1 to 2 eye contact people, so I will let you go. Thank you so much for being part of this. I hope that you enjoy the rest of the conference. I hope you have a good coffee. I hope to see you after, during the drinks portion. Thanks, everyone.
So this presentation is called Intersections of Economic and Workforce Development. I am Lou Mandarini. I work for Mayor Michelle Wu as a labor policy advisor, longtime labor and employment lawyer, come out of the employee benefits world and sort of do all things with labor policy and workforce for the mayor. So I'm going to serve as the moderator today, which is basically just keeping things on track and introducing presenters, trying to talk less so you can talk more. And that will be my role. We have with us Natalia Uribe, who will be the provocateur. Natalia.
I don't know if I need this. Do you need it for the Zoom people? Hi, everybody. No, sure. Hi, everybody. My name is Natalia Uribe. I currently serve as a fellow at the Eastern Bank Foundation, and that is a fun term to say that I serve as the expert to lead the strategy around small business for our foundation. I come from the city of Boston. I worked with Mayor Walsh previously, Mayor Kim Janey, and Mayor Wu. And I worked in lots of different capacities, from running the citywide planning process, Imagine Boston 2030, back in 2015, and most recently as the director of small business before and during the pandemic. So it's been a whirlwind of events. I'm really excited to be here. My job is to push, so I am a friendly person, but I am going to be pushing these guys a little bit to really get into dialogue and a conversation around solutions and next steps. Yep.
Okay. So let's talk a little bit about the flow today. So we've got, unfortunately, one of our presenters has dropped out. The presenter, Mass Inc., that was going to present some polling around return to work in the pandemic. So if you came for that one, you're out of luck. But stay anyway, because we have 3 great presenters on 3 diverse topics. That's true. You may say to yourself that there's a great deal of diversity in this program, and since we know each other so well, I'm going to acknowledge that these things are sort of grouped together loosely. But we're going to let the presenters do their thing, and then we're going to have about 5 to 7 minutes of conversation questions after each of the presenters, maybe somewhere on the order of 15 to 20 minutes each, about that specific presentation, so that we can engage and you can ask questions, have discussion, that kind of a thing. And then after the 3, we'll have a more open and freewheeling conversation, tying together the threads of all 3, or not tying together the threads of all 3, if that's what we end up deciding to do. So the one thing I would say, both for the discussion and the conversation after the presentation, and then for the 30 minutes or so at the end, let's be respectful, let's be civil. And I think the one important rule is let's not filibuster, let's not make speeches. Questions, comments, discussion, colloquy back and forth is great, but sort of holding forth as if it's the US Senate, not great. So with that, let's go ahead and start with our first group of presenters. So City of Boston is going to assert personal privilege and have our first presenters, which deal with a very important initiative for us and for the youth of Boston. Our first presentation is called Building a More Holistic Workforce Development System for Boston's Youth. And we have two presenters who are going to help us with this. Dr. Alicia Modestino from Northeastern and Rashad Cope, our Deputy Cabinet Chief for the Worker Empowerment Cabinet in the city. Do you want to introduce yourselves directly and then start? Or, yeah.
Hey, good afternoon, everyone. As Lou mentioned, Rashad Cope, Deputy Chief with the Worker Empowerment Cabinet, and also the Office of Youth Employment and Opportunity. And essentially, within the city, my role largely is to provide oversight of workforce readiness programs and initiatives to advance the lives of Boston's young people. That's around youth jobs, that's around access to skill and career development, educational training, and also strategic partnerships with a number of community-based organizations, small businesses, and stakeholders within the city of Boston as well.
Thanks. I'm Alicia Modestino. I am an associate professor at Northeastern University in the School of Public Policy and Urban Affairs. I'm a labor economist by training. I've been working with City of Boston in a research practice partnership for 8 years now, working closely to evaluate the Summer Youth Employment Program along with a bunch of other different initiatives. And then I'm currently also leading something at Northeastern called City to City, which is an initiative to provide the infrastructure both inside the university as well as to our policy partners to do community engaged research. So if you're interested in more about that, we can talk afterwards. I'm going to launch into this. Is that? Oh, sure. Okay.
Everybody have their moment in the sun, and then we can start with the actual presentation. So our second presenter, Nick Caros. Am I saying that right, Nick? Yeah. Do you want to introduce yourself and introduce the?
Sure, thanks. My name's Nick. I'm a student here at MIT, but actually in the transportation program, not in the media lab. And I've been working mostly with transit agencies over the 4 years that I've been here. MIT holds research partnerships with the T, but also Chicago, Washington, DC, New York, San Francisco. So I've had the pleasure of working with all those different agencies, mostly looking at how remote work is affecting the demand for public transit, and then also what public transit agencies can do about it. But actually today, I'm going to be kind of stepping outside of that and talking more about land use solutions to dealing with the new demand for remote work and how people are traveling around the city.
And then our last presenter, Monson. Introduce yourself and tell us what you're talking about.
Thank you. Hello, everyone. My name is Mohsen. I am a research scientist at MIT, connection science, and my research field is computational social science. It means using large scale data sets from different sources to understand people behavior and use it for future prediction or decision making, supporting for governments, business owners, and people. And today I will talk about the recovery of restaurants in Boston greater area and also New York City after the pandemic. Thank you.
We'll bring it full circle with Alicia and Michelle to do our first presentation.
Great, thank you. I'm going to do my professor thing because that's the only way I know how to present. So just in case you were wondering, what is the Summer Youth Employment Program? It sounds like pretty obvious, but you probably might want to know some of the details about it. This is actually a program that's gone on for decades. There are also large summer youth employment programs in New York, Chicago, and DC, and smaller ones all across the United States, across about 50 or so cities in the US. Boston's been employing upwards of 10,000 young people every summer since the early 1990s. These are largely youth who are 14 to 24 years old. They work for 6 weeks in the summer, largely right after July 4th through the middle of August. They're paid the minimum wage, whatever the prevailing minimum wage is in that year. And they're placed in a job, could be with a city agency, could be with a community-based organization, could be with a private sector employer. And they're also provided some additional career readiness curriculum that includes things like job readiness skills, how to search for a job, soft skills, job safety, et cetera, things like that. Our research partner with City of Boston has shown, oh, there we go. It's all going to fill in eventually. So we've been doing this work with City of Boston since the 2015. And we've had this longstanding research practice partnership that's demonstrated the program's really highly effective, right? So it has huge impacts on not just criminal justice, but also academic and employment outcomes for young people. And what's unique in Boston is that not only do we generate this research evidence off of administrative records, so school records, criminal justice records, employment records, but we also combine it with a pre-post survey where we're asking young people, what are the things that they learned during the summer? And that tells us something a little bit about the mechanisms behind these impacts. So for example, in terms of crime, the improvements that we see, so there's a 30% reduction in violent and property crime, that's linked to the soft skills that young people are learning during the summer. So everything from learning to manage their emotions, resolve conflicts with a peer, ask adults for help. We also find impacts on academic outcomes that are linked to increasing academic aspirations as well as work habits. So there's about a 5 percentage point increase in high school graduation rates. This is very closely tied to improvements in attendance in the year after participating in the program. So for example, when I ask young people in a focus group, what did you learn this summer? The first thing they say is, well, geez, if you're going to be 5 minutes late, don't show up at all. Apparently that's not something you learn in school, but you learn it on the job because you're not going to be working there much longer if you don't show up on time. We also find that the private sector jobs increase the likelihood of taking the SAT and also attending college, and in particular, moving from a 2-year to a 4-year college, increasing those academic aspirations. And then finally, we do find that it also increases the likelihood of having a job in the 1 to 2 years after participating in the program, particularly for youth of color. And all of this research evidence is based off of a randomized controlled trial. So prior to the pandemic, all of the jobs were randomly assigned. So there's a very well-balanced treatment and control group underneath all of this research evidence. So what are we doing now? So what's the look forward here with this new partnership with the city? So we have an institutional challenge grant from William T. Grant Foundation. And in the spirit of building back better after the pandemic, we're looking to make improvements to the program. So during the pandemic, you may not know this, but the City of Boston's Summer Youth Employment Program actually operates off of an ecosystem. It's not just the City of Boston. It's also large intermediaries like the Boston Private Industry Council, nonprofit organizations like Action for Boston Community Development, other city agencies like Youth Options Unlimited that works with court-involved youth, and also private entities like MLK Scholars, which is funded by John Hancock. And so during the pandemic, those entities came together, developed 4 new tracks of programming, and all of that research evidence was taken to Mayor Walsh, who invested an extra $4 million of CARES Act funding into the program during that summer, and in particular to stand up 2 new tracks. One was a Learn and Earn program where young people were paid to take community college courses, meaning the course was paid and their time to take it was paid, because all of our research evidence had shown that half of our young people were paying some kind of household bill with their summer earnings. So they're paying rent, utilities, groceries, cell phone. I mean, I would love it if my kids would pay their own cell phone bill, right? So they're contributing to their households. In contrast, other cities like New York, where it's a very top-down program, all coming from the city, canceled their programs during summer 2020 and left 75,000 young people unemployed. So coming out of the pandemic, we developed this new partnership, and we have sort of a research agenda that we're moving through here. Everything from increasing coordination alignment across that ecosystem. You can imagine the pandemic revealed some of the vulnerabilities in that, as well as evaluating some of the program features in terms of job matching, the quality of jobs, being able to ladder those jobs from one summer to the next to increase skill development, expanding some of those post-secondary opportunities under that Learn and Earn program, and also how do we link the summer jobs program to other year-round programming, right? It's a very impactful 6-week program. And then at the end of the summer, we say, see ya, whereas we could, right, continue those employment opportunities into year-round employment or link them up to other opportunities if they're graduating, like the tuition-free community college program. So in our first year, we really spent a lot of time in this planning year doing a systems mapping of the entire ecosystem, and then also doing an efficiency and an equity audit, right? So the program's very impactful, but there's always been, sort of ways that we can improve the processes that really got revealed during the pandemic. And so I'm going to preview some of those results for you today, and we'll be releasing a report in the next month or so.
In terms of the efficiency audit, so like many other cities that have moved away from random assignment, especially since the pandemic, there's actually an interesting matching problem that happens with trying to get young people into jobs and also through the entire hiring and onboarding process. And because it's of that complexity, there's often jobs that even if a young person was selected for it, at the end of the selection process, sometimes they're not always hired into it. And because of that, in terms of efficiency, right? For example, in these direct jobs, so these are jobs where the employer partner, usually a city agency, is relying on the city to do all of the hiring and onboarding and payroll for that hire. Last summer, there are about 3,400 openings that were allotted to those direct jobs. About 2,800 young people were hired into them, and that left about 564 of those job openings without a young person who was hired into them. So on average, there's about 10 to 15% of these job slots that are unfilled. You might say, what's the big deal, right? But that's money left on the table. That's community-based organizations that maybe aren't getting the summer help that they rely on. And then also a young person, right, who could be filling that job. We should also mention that there's two other types of positions here. So a grant type position is when the city grants out their funding to an organization, usually a community-based organization, or even this year, Northeastern's going to be a partner. And when that happens, then it's the employer partner who is the one responsible for doing all the hiring and onboarding and payrolling. And you can see even when we grant out those dollars, right, the grant partners are facing the same challenges that the city is in terms of getting young people into jobs, right? And then there's also a bucket of money for programs like the Learn and Earn program and things like that. The other thing that I wanted to highlight is why do we have sort of this inefficiency? There's an interesting matching problem that happens inside the summer jobs program. And what we did last summer is we collected all of the application data from the city of Boston and looked at where young people were placed and how they were hired and had this sort of snapshot every single week. And what we find is that young people typically apply to only one job. They're like wildly overconfident. My teenagers are the same way. They're like, yes, I've applied for a job. I'm done. It doesn't really work that way, right? We all know that. The other thing is that they tend to bunch up and apply to particularly popular jobs, right? So I gave you kind of two examples here of why this is such a problem. So right here for the Dorchester YMCA, you get 355 young people applying for 33 positions. If most young people are applying for only one position, that's going to leave a lot of youth who are not hired, right? On the other side, you have the BCYF Perkins Center, which is only getting 3 applicants for 20 positions, right? So there's a high degree of mismatch that's happening here that the city and other agencies have to resolve. The second thing is that the onboarding and hiring process is very complex. So I'm showing you what the process is over here. You can just look at the number of boxes and nod that it's very, very complicated. My graduate student had a hard time getting through this the first time to get hired by SuccessLink to be a partner with them. And what happens is that the program starts by July 6th, right? Even several weeks after the program, there's about 15% of the young people who can't get through that onboarding process and get hired. The other point that we wanted to highlight was also the equity audit that we did. So once you move away from random assignment and allow employers to pick 100% of their young people, it's probably not too surprising that they replicate all of the inequities that we see in the labor market. They're much more likely to hire white youth. They're much more likely to hire youth from the prestigious exam schools. And yet this is a developmental program. So that is not what we are aiming for. And to their credit, when we brought this research evidence to the city, they didn't say like, oh, wow, like either we don't believe that or we don't want to hear that, but said, great, help us fix it. So we designed a job matching algorithm last summer, and we stratified it by race and school type to make sure that at the end of the day, the distribution of the youth who were hired was matching the distribution of youth who applied. And so this is just showing you selected by site. This is the employer selections. You can see that they're hiring fewer or selecting fewer African-American applicants compared to the total distribution. And you can see these are the ones that we selected with a job matching algorithm that's overcompensating for that. So I'm going to hand it over to Rashad because we developed this report that included a whole set of recommendations that the city is following based on this research evidence to improve both the efficiency and the equity of the program.
Thanks, Alicia. I'm going to run through these next 3 slides fairly quickly. So my role or our role as a city of Boston, our role from a practitioner angle of the research and evaluation partnership is to really help Alicia and the Northeastern team, right, make sense of the data that they're analyzing, and speak on behalf of our stakeholders and provide a contextual lens around the work, really to address the inequities that Alicia just mentioned, to increase alignment and coordination, and to also just focus on our stakeholders and improving outcomes and program quality. So we work together to develop a process improvement plan. We're going to walk through just a few pieces of that process improvement plan here. It's helpful to understand how the program works, right? So we're going to discuss very quickly application and selection process, onboarding and job quality, and alignment and coordination. So with the recruitment and application process, so this is a city-wide effort to inform young people across the city of Boston that youth jobs are now available, right? And applications are open to any young person that is interested in participating in the city's youth job program. This happens across the ecosystem. The next piece is the selection, the matching, and the placement process. So young people can apply to jobs in multiple ways. They'll apply. The employer, and then in this sense, it can be the community-based organization or the private sector company. They engage in a discussion with the young person. They vet all the candidates. As Alicia mentioned, there could be, 30, 40, upwards to over 100 applicants for each of these employers. So they vet the young people and they make their selections. We as a city have also implemented an equity placement system as well, in which we would fill 30% of the slots, and that 30% would be filled with young people who apply to jobs and are not selected by organizations. So with the recruitment and application process, one of the issues we found here is that among those youth who completed the application, more than half applied to only one job. And this happens because young people are pretty confident that the job that they apply to is the job that they actually will get selected for. That doesn't always happen, right? So we realized that this created a number of just unfilled positions, as Alicia actually showed in her research. So some of the ways in which we were looking to address that is, one, just adding a searchable table. So when young people are searching the jobs, they can search the jobs by location, they can search the jobs by occupation, industry, and then, which we're hoping that makes it easier for young people to apply, and then sending text messages and emails to young people, encouraging them to apply to more than one job. We found that pretty effective because young people are not responsive to email, but young people are very responsive to text messages as well. And in some cases, we also sent those text messages to their parents as well. And then with the selection and matching process, Alicia already talked about, that some of these jobs reproduce the inequities. So we'll jump past that one. With the onboarding process here, among positions where young people were selected for a job, about 15% are unable to complete the hiring process, right? So we understand how much of a challenge this is. And this happens because young people are asked to pull together a number of hiring documents, maybe some of the same documents that each and every one of you all had to submit when you all were hired and onboarded for your job. So we were looking at a few ways to address this. One, we did expand the grant making program, right, by transferring the administrative responsibility away from the city over to our employers, over to our partner organizations. And that helps decentralize the hiring process. So each employer would pretty much just manage the hiring, vetting, and the payroll of young people. And then we've also expanded in terms of just job quality here, we also realize that not all job experiences provide the same developmental opportunities for young people to learn new skills and to move up the ladder. So the focus here was to really think about creating a tiered job system that ladders job opportunities from entry level or more skilled positions, both across the ecosystem. And also to think about skills mapping and categorizing jobs and developing criteria of improving job quality as well. And then going quickly through this, Lou. And then the last two pieces here was around the ecosystem coordination. So although the decentralized nature of the Summer Youth Jobs Program, it was pretty resilient throughout the pandemic. There is a need for greater coordination and alignment amongst all the partners. So we have been conducting just regular meetings of our summer youth employment ecosystem partners to really just identify common themes and share best practices. And then the last piece here is really around just citywide coordination. And I was having this conversation with someone earlier today. Youth development systems just here in Boston, pretty siloed. There's youth jobs programming happening, within BPS, within other sectors. And our focus is to think about ways in which we can coordinate, even at the state level, coordinate citywide resources to make sure that there's a holistic approach and a holistic strategy around addressing youth work here in the city. And I think I will end with just making a note that like this research, it absolutely just offers like tremendous value for our cabinet right here in the city. It provides Boston really with an opportunity to provide leadership, strategic action, and mobilize a number of partners to really focus on an issue that we feel is critical in the city of Boston. When we think about just the intersection of workforce and economic development, we have to continue to make sure our young people are a part of that conversation because we all know that young people definitely are our future workforce. So I'll stop there.
So we're going to spend about 5 minutes with questions, comments, concerns based on that presentation. If you would be good enough when you speak, just to introduce yourself and tell us where you're from. I'm going to hand it off to Natalia first to see if she feels like provoking anyone.
Well, I think I'm going to go last because I want to hear the questions that come up.
That's provocative. Question or comment? Anything they want to ask?
Matt Frank, I'm the Supportive Services Manager and Special Projects Coordinator at the Chelsea Housing Authority. I forgot where I worked for a second. It's because I saw you. I used to work under you. I'm not with Main Streets. My question is for youth that already had jobs before something like this came up. I know I myself started working at 15, and I never really had an opportunity to do these, more exciting projects. And my concern is when it's only 6 weeks during the summertime, how do we get people who already have jobs, who are already supporting their families and what they're doing into these sorts of fields so then they can grow from there? Thank you.
Yeah, I'll jump in and Alicia if you can add as well. So I think the goal here is to make sure that this program is open to any young person, mostly that has not held, a job, outside of the summer jobs program. But those folks that do have year-round opportunities, we do expect that they can use this as a way to explore different industries and different occupations as well. So I really think it's just trying to do a better job of just, aligning, the opportunities that young people do have and making sure that, if they're working within retail, if they have if they're working within hospitality, right, that they still see this program as an opportunity in which they can continue to learn and develop skills.
I guess the other thing that I would say is for young people who have never held a job, this program is the way that they get their foot in the door in the labor market. It's really, really hard if you're a 14 or 15-year-old to get a job. My own kids who have grown up, now they're all in college and beyond. When they were 15 as white kids in the suburbs, they couldn't get a summer job, right? So this is a critical way to give kids that entry point where they learn those basic skills of showing up on time, learning to work in a team, how to conduct yourself at the work site. And then that sets them up for some of those private sector opportunities. The other thing that I would say is there's a progression even within the program, right? So a lot of the 14 and 15-year-olds start with the day camp and the summer camp jobs, right? And those are pretty basic entry-level positions. And then the following summer, they'll move on to a job with a community-based organization, right? Or a nonprofit doing something that's more hands-on or leadership. And then by the time they're a rising junior or senior, they're getting a private sector position, right? And I'm talking like they're working at Mass General Hospital. They're working at, Sanofi Genzyme. I mean, these are real like career sector type jobs. And that's where we get that impact in terms of the college going increase, as well as moving from a 2-year to a 4-year. And so I think it's critical what Rashad and his team are doing now in terms of getting the word out about what these opportunities are, that there's even an opportunity for learn and earn, so that young people and their families can see what that progression is. Because when times are good right now, right, when there's a lot of job opportunities and employers are paying high wages and they're looking to teenagers as potential workers, it's hard maybe to convince young people to take this opportunity. But the other thing is to remember is that this program's there also when we're in recessions, right? And when nobody is hiring young people as well. So I think that there was a little bit of a challenge, like when you are in a strong job market, to make sure that you get that message across. And that's a lot of what his team's doing right now.
Anybody else have questions, comments about this?
Hi, sorry. My name is Peter. I work for the Massachusetts Data Office, which is part of the state government. One thing I'm interested in is what's being done now or could be done to deal with the mismatch by making sure that all of the descriptions are sort of, optimized, made as desirable as they can be, whether there are specific trends in which jobs don't get a lot of applicants. And, I get that some of them are just objectively less desirable, but maybe some of it is because they're not, advertised as well. So just curious about that.
Yeah, I think just a quick response to that. We have probably between 150 to 200 employer partner organizations, right? And every one of these organizations designs their own job program, therefore they're designing their own job descriptions, right? And we have seen some incredible job descriptions, and we've seen some job descriptions that we feel need some additional work as well. And one strategy that we are continuing to think through is whether or not we can host a employer academy, right, to just walk folks through just how do you maximize the impact, as an employer when you're engaging with young people. And then within that, it helps folks develop strong job descriptions, that are attracting the young people that they're looking to attract as well. So I would say.
The last thing I'll say about that is it might sound like, putting up that table on the website with being searchable by occupation or industry or location sounds small potatoes. But before that, young people had to go into the city's hiring system, and it was not searchable by anything whatsoever, and except for the employer name. And so you get those kinds of mismatches because they only know the, Roxbury Teen Center that is down the street from them, right? And so they can search on that name, and maybe a couple other employer names that they know, and that was it. So this was a big innovation to take that information out of the system and put it on the website to be able to be searchable. The other thing that I've learned in this whole mismatch thing is that young people do not search for jobs the way the rest of us do. They, even walking around the job fair last week, they look for, is this inside or outside work? right? Like they want to be outside in the summer doing something. They want to know the location, right? Like, is it easy for me to get to? And do I know and trust this employer, right? So there's, I think, a lot more to go into this matching algorithm than the simple thing that we were doing. And that's some of what we're iterating and looking at the job quality and collecting the skills and things like that. So in addition to writing those job descriptions better, we're learning a lot about how people look for jobs and then how to make it so that we can thicken that job market and be able to match more young people to positions.
In the interest of time, we're going to move on to our second presentation from Nick Caros about community workspace deserts.
Okay, well, thank you very much. So I'm going to switch gears here a little bit and talk more about the economic development side rather than workforce development. But this is a really cool opportunity for me, actually, because this is very much still a work in progress. And I have an engineering background. Mostly what I try to do is come up with tools to solve problems. And I kind of leave it to all of you, the sort of smart policy-oriented people, to figure out what kind of problems to solve and what the values we should apply to, when we're trying to solve those problems. So as I get towards the end of the presentation, I'll actually leave you all with a question for you, which is to say, you know, what kind of values should we be applying when we're using these kind of tools that we're developing here? So is there a clicker as well? Thank you very much. Okay, so yeah, I'll be talking about what I'm calling community workspace deserts, and then how we can try to address those and using Greater Boston as a case study. So to sort of motivate the problem, one thing that you see often in the discussion around remote work is that people use the term remote work and working from home as sort of synonymous with each other. But that's actually not really what we're seeing in the data that we've been collecting in surveys. People are often working close to home, but not necessarily at home when they're working remotely. And you can see that this has started to pick up some traction across a lot of different news publications over the last couple of years, referring to these third places. So, you know, you can see places like Forbes and Axios talking about this, but also commercial real estate publications are focused on this, international organizations. So it's becoming quite a trend, but I really don't think people are talking about it enough. And what we see from our surveys is that actually, this is just a breakdown of total worked hours in the United States by the location where that work is happening. And so while, of course, a lot of work is still happening at places like employers' primary business premises, client work sites, and then at home, like we're often talking about, a lot of this work, the remote work side, is happening at places like coffee shops, libraries, co-working spaces that people are choosing to work at because maybe they don't have a supportive environment at home for remote work. Maybe they just need a change of scenery. And then you do see some anecdotes about how people are working with friends or with family to try to overcome some of the loneliness of just kind of sitting at home at your apartment all week while you're doing your work. So actually about 1/3 of all remote work hours in the US right now is happening at places that are not the home. And because we have all this survey data, we can estimate the demand for working at third places across Greater Boston by neighborhood. But first, just to compare Boston to some other peer cities, this is a breakdown across all the cities in the US. This is a nationwide survey that we've been conducting since May 2020. You can see Boston is somewhere above the median in terms of the demand for working at these third places, but not quite as high as places like New York, Los Angeles, Miami that lead the country. And just breaking that down across Greater Boston here, we can see that oftentimes the demand for working at third places sort of tracks well with income. So places like Brookline, Cambridge, you're seeing a bit more demand for working at third places rather than in other neighborhoods around the area. So it's not evenly spatially distributed, but the range on that graph is actually not all that big. So it's going from about 16% to 22% of worked hours. And now we can take a look at the supply across Greater Boston of places where it might make sense to do this sort of work outside of the home. So if we just look at co-working spaces, this is using point of interest data from a company called SafeGraph that measures these things. We can see that co-working spaces, perhaps unsurprisingly, are really clustered in the downtown core, Back Bay, and Cambridge and Somerville. And actually, if we look at the distance from each census block group to the nearest co-working space, we can see that there's huge parts of the area that have no co-working spaces whatsoever. And actually just regressing the distance to the nearest co-working space with the income of that census block group, you can see that the higher income block groups are much more likely to be close to a co-working space. And this isn't a conspiracy, I don't think. It just generally makes good business sense probably to locate your co-working spaces somewhere where a lot of people are going to work and paying a lot of money to live. But if we add libraries, which is another potential third place, you can see that the spatial distribution is actually a lot more even. And actually, if you add libraries to this data set, you actually eliminate the income effect altogether. So there's no statistical relationship now between distance to access a third place and the income of the particular census block group. So in this case, this is one example of where the public sector has sort of stepped in to provide services across the area in a case where, and of course, this goes back before remote work really exploded in 2020, but across the area where the private sector was not necessarily doing that. And in the case of remote work, we're actually seeing this all around the country and around the world of the public sector now stepping in to say, hey, there's a lot of communities here that don't necessarily have suitable places for remote work to happen. And maybe the government can step in and create those spaces for people who might otherwise have to travel quite far or maybe can't afford a co-working space. Ireland, I think, in my research, has done the most to actually promote this. They built about 400 different remote working stations across the country. A lot of this is focused on kind of development in rural areas. But Maine also has a subsidy program, so co-working space developers can apply for funding in order to offset the cost of creating new co-working spaces. And then Canada, where I'm from, the federal government is actually operating their own co-working spaces for their own employees. So only federal employees are allowed to use them, but that just avoids having people to have to travel to downtown Ottawa or local regional centers in order to get to work. So my question as an engineer is that if we're going to be doing these sort of things, where should we actually place all of these shared workplaces? And as I mentioned, there's sort of a bunch of different goals, social goals that you could have when you're actually designing these algorithms to choose the optimal locations for shared workplaces. Just going back to one of the previous slides, you can see that there's a huge difference in access across neighborhoods, right? And I mentioned Cambridge and Somerville have some of the sort of lightest colors in this choropleth, so they have some of the best access. And if our goal was to give everybody in the area access, the same distance access as the average Cambridge and Somerville resident, you would have to build 237 new shared workplaces across the region. So it doesn't seem entirely feasible to me, but that's one, kind of arbitrary goal. Another is we talk a lot in urban planning about 15-minute cities. So if you considered that a shared workplace would have to be a part of the bundle of services that are included in a 15-minute city, and we only use walking speed in this case, 91 new locations would be needed to give everybody in the Boston area, the towns that I chose to include here, access within 15 minutes walking to a shared workplace for them to do remote work. But if we talk about it, say, instead as a 30-minute city, maybe, we don't need to be as close to these shared workplaces because we're not visiting them quite as often. You would only need to build 12 new locations. So maybe a little bit more feasible. And then the last scenario that I looked at is the one where I was sort of talking about alternative goals, which is to say that if we had, say, funding for 10 different locations, where should we actually put them across the region? So the transportation engineer in me first started looking at minimizing the total travel distance for people to access these locations. And in this case, I'm just sort of arbitrarily not including libraries. So it makes the results a little bit more interesting, but also libraries aren't necessarily great for working in large groups anyways. So this is just looking at co-working spaces, keeping those where they are, and then saying we're going to build 10 new locations to serve people across the community. Where should we put them? So you can see, kind of makes sense. These stars end up in places where there really aren't existing community workspaces and sort of evenly distributed across the area. But there's other goals to just rather than minimizing distance. So one of the big impacts of remote work is that it's reduced the social interactions within our community, right? People aren't necessarily running into others when they're going into work. It kind of prevents this flow of ideas that people often talk about as sort of the economic driver of cities in general. So if we wanted to maximize total interactions, we can do some math that's going on behind the scenes here, and then place all of those 10 locations. And you'll notice that the actual locations are quite different than they were before. And mostly what's happening here is that they're being located in places where the population density is quite high and there's a lot of demand for these shared workplaces. And then lastly, another thing that some colleagues here at the Media Lab have really looked into is that remote work has caused a lot of segregation, social segregation as well. So one of the big drivers of people leaving their own neighborhood to interact with others from other communities was the work trip that was happening quite often. So what happens if we would actually design these types of shared community workplaces in order to minimize social segregation? And here I just took one example, which is income segregation. So it basically is looking at opportunities to have mixing between the lowest quartile and the highest quartile of the income across the metro area. And what I found quite interesting here was that actually in sort of the southern, I left the previous results on here as well, just made them gray. And you can see that down in the southern part of the region, the locations don't really change that much, maybe over by I don't know, half a mile or something like that. But actually in the northern part of the region, the locations have changed quite substantially from just maximizing social interactions to minimizing income segregation. So I don't actually have great insight into why that might be. This big difference between the south and the north of the metro area. But I'm also not from Boston, so I'm not as familiar with some of these communities. So if anybody has any insights into that, please do let me know. And so I'll just leave you with an open question, which is, what would you prioritize if you had the funding and you wanted to be able to create some of these new shared workplaces, which I really do think are in high demand across the region? Where would you put them, and what sort of goals would you use when you're deciding how to allocate that funding? And yeah, feel free to reach out to me after this if you have any questions. Thanks.
Okay, so we've got about another 5 or 7 minutes where we can have conversation or ask questions about that presentation. Thoughts, comments, concerns. If you all in the back want to come in, we've got seats up here. It's actually much better on this side of the glass. If you want to come. So there are some microphones floating around on each of the tables for anybody that wants to ask a question, make a comment, make an observation. Anybody want to dive in? Come on, the water's nice. Okay. They're all.
I think it's on. Hi, Ben Cole. I work for Jobs for the Future. This is mostly just maybe a smaller data question. For prioritizing things like social interaction, where did you get that type of data?
In that case, we were just looking at what the demand is for these third places, which I showed on an earlier slide, and then figuring out, how many people could we expect to go to each location depending on where we built it, and then trying to maximize the number of people that would go to each location to interact with one another.
Gotcha. Thanks.
And we make some broad assumptions, like people aren't going to travel more than 3/4 of a mile or so in order to actually access one of these locations. They probably just stay at home. So in that case, that's why they generally end up in places of high population density. It sort of attracts the widest range of people.
So another hand there, somebody that wanted to.
So I had a question. Did you, in terms of what would you prioritize, did you at any point aggregate all the different maps that you made to see if there were any sort of commonalities between all of your different variables, to see if there was one particular point on the map where, oh, this would check off every single box that I'm looking at? Did you ever think of doing that?
I have thought about doing it. Yeah, I didn't do it for this particular case study yet, but that's one really smart approach to solving this problem, is not just to consider each of the objectives in isolation, but maybe consider them all with sort of varying amounts of weights, depending on what your objectives are. But if you wanted to equally say weight all 3 of those objectives that I showed you or some other ones, I suspect you would find some sort of locations that are close to optimal for all of the different locations. Yeah, great suggestion.
Another question? Comment?
I'm Ahmed Yassin. I work for the Center for Health Analytics and Investigation. And I was curious about more of the methods in deciding how social interactions work. I was wondering if you could explain a bit more about that.
Sure. Yeah, we took a pretty naive approach, which is just to say, I guess we could frame it more as opportunities for social interactions rather than social interactions. So we just wanted to basically put as many people in one place as we could and assume that social interactions will follow from there. But we didn't make any assumptions on what kinds of people are more likely to interact with each other or not. And of course, the sort of economic development side of social interactions really depends on the combinations of people who are actually doing those interactions. Ideally, that's why you see the sort of clustering of, say, the tech industry in San Francisco, is because there's a lot of people who can have conversations on similar topics. So interactions between people with completely different industries or occupations might not be as useful as people who work in the same industry. But we just assume that any opportunity for social interactions would be treated equally in order to come up with those maps.
Any other comments, questions about this presentation? Natalia, you want to provoke anybody?
You want me to start provoking already? I don't know if it's fair. Yeah. Well, let's go with the third one and then we'll.
Okay.
Third presentation. Restaurant recovery?
Yes.
This was our. That was great. Okay.
All right, so as in the introduction, I said, like, my name is Mohsen. I'm working in MIT Connection Science and Human Dynamics groups in Media Lab and IDSS. I am going to talk about our work jointly with Amir, my co-author, and also Alex Pentland. In our group, as I said, we do mostly computational social science, and it means that we want to use data with the ultimate aim of empowering communities. So here, this study is about understanding the factors which are associated with restaurant food traffic recovery in post-pandemic. So why restaurants and why food traffic? So restaurants and food industries constitute a large proportion of the economic activity in most economies. So they are very important entities in economic activity. Also, as employment, based on the estimates with Bureau of Labor Statistics, about like 12 million people were hired in the US in 2019 in restaurant industry. And the maximum share among them were belonging to waiters and waitresses with 20.7%. So this shows the importance of them also, like in employment. And the physical space which restaurants provide are very fundamental for social interactions. And we know that the social interactions are very helpful to societies flourish and also revive. So all these together, when the COVID-19 happened, because of the all these COVID prevention measures, most of the restaurants and most of the businesses had to close. So they faced challenging situations. Many of them were permanently closed. Many people were left unemployed. So altogether, this we are going to understand restaurants, how actually they recovered after the pandemic. So here, what we focus on is the information about the restaurant's customers. So there is another work in our group by Takayabe and Esteban. So they focus on the location and dependency, physical location dependency of the businesses on each other on recovery. But here we mainly focus on the customer information. So what data sets we use? So we use business places information, which provides category and also detailed information like location, square footage, and other information about the locations we study. We also have this weekly visit patterns from SafeGraph, which counts how many visits to each restaurant happened weekly, and also from which census block group in the geography of a study. And what happens, we collected data from Yelp.com. Actually, we collected this in 2020. And Yelp.com is, this business directory which has information about businesses, and people can go there and review and rate them. So they have this, Yelp.com had this general information about the businesses, like what is the business name, where is it, where the address is, what are the open days, what are the category tags, etc. But after restaurants reopening, they added more information, and it was about their COVID prevention strategies they adopt. And then, for example, they had like mask mandates. You had like tick or like cross like this. So it is showing like if they impose mask mandates on their workers or not, sanitization, if they provide sanitizations, if they have reduced their capacity to reduce the COVID risk and also the social distancing, etc. So we collected all these data from the Yelp.com, and of course we have data about census block groups from census, and that is mainly what we use here is their median household income and education level. So we have definitions. The first definition is pre-pandemic period. We take all year 2019 as 1 year as pre-pandemic, and then we have recovery. Recovery actually starts from July 2020, when the restaurants were allowed to reopen for the dining services. And we have a definition for that, which is recovery index. Recovery index is the average visits in the recovery period weekly divided by the average pre-pandemic. So it means that what percentage of customers they could bring back to their physical space. And the geography of study are Boston metro statistical area and also New York City. We consider the restaurants which have foot traffic records from 2018 until the end of recovery period. So why 2018? Because we thought restaurants that had been working and were operational during 2018, they had enough time to reach their capacity of the customers. And so we don't study the permanently closed restaurants because we want to understand the recovery. So we have 927 places in Boston and also 4,000 places in New York City, mainly concentrated in the Manhattan area. And so after intersecting with Yelp data, we have 968 restaurants in New York City. So looking at the recovery ratio, we see both in Boston area and also in NYC area, restaurants actually didn't do that great. So the median is about like half. So in the year after the pandemic and after they were allowed to reopen, they could bring mainly half of the customers. But yeah, there are restaurants, some of them are outliers, but mainly they are half and we don't. So our regression models, this is the only equation here. So that yeah, so here we look at the recovery index and then try to understand what are the factors associated there. So first factor, which was important for us, was the diversity of the customers. And we measured that with the entropy metric, because usually most of the studies have shown that the diversity can help, if you have like diverse interactions, if you have from diverse groups of friends, and also the business places who had diverse customers or diverse visited, they could do better in general. So we take the diversity, and then we have other metrics like mean income of the customers, mean education level of the customers, and we control for other factors like number of the places the people come visit there, category of the restaurant, and information from Yelp, including price level, star rating, social distancing, and all. So altogether, what our results show. So when we do this analysis, the main important finding is that actually it was counterintuitive for us that customer diversity actually had negative association with their recovery, and it was significant in this analysis, and it was the same in both New York City and Boston area. But of course, intuitive parts that show customer mean income help the restaurants in their recovery. I mean, they were who had higher customer mean income, they were more likely to recover faster, and also mean education level, which is negatively associated. Probably the reason is people could work from home and then didn't visit that place. So adding Yelp data, what important finding we have there from all the factors we added from the Yelp, what was interesting and that could show a positive association with the recovery and was significant is mask mandates. So people were more likely to go to the restaurants which had mask mandates on their workers, and they had to, wear masks during the services. So altogether, we studied restaurant recovery and then controlling for all these factors. We showed that how restaurants, what were the factors restaurants associated with restaurants recovery. It was important to know that the diversity of customers had negative association with their recovery, which was counterintuitive. And then people were trying to go to the places with the lower risk. So because of that, maybe they chose the places with mask mandates. And yes, we hope that the results of this study can help the restaurant business and people in this business to get help from these results and do some different, let's say, marketing decisions or adopt marketing strategies that can help them in future exogenous shocks like the pandemic. Yeah, thank you.
We can take about 5 minutes or so for comments and questions about this particular presentation. In the back there's a microphone on that back table somewhere, if someone would get it to you.
Hi, I'm Ronak Basu. I'm a postdoc in the Department of Urban Studies and Planning here at MIT. Thanks for your presentation. A couple of questions, would love to hear your thoughts, questions/comments, I guess. The first one is about your measure of restaurant recovery index. So if I remember correctly, you were looking at the ratio of the number of visits to a restaurant and using that as like, how has that changed over time? Has it gone back to pre-pandemic levels in 2019, right? But since the pandemic, there's been such a huge upsurge of food delivery apps and online ordering, and a restaurant that has fewer visits may not necessarily be doing worse because a lot of their usual customer base might have shifted to online ordering. So love to hear your thoughts on that. And the second comment I had was, I think with SafeGraph data and similar data sources, the unit of analysis is a census block group. It's not a person who's visiting. So when we take data that describes the census block group on average or as a median, so we know the median income, for example, but that's the median, right? So there could be households living in that block group with very different incomes compared to the median. So we don't know who's actually visiting the restaurant. So that kind of like, I'm struggling to reconcile how one might relate the characteristics of a block group with the characteristics of a person who actually went and visited the restaurant. Thank you.
Yes, sure. So about the first one, as I explained, we don't measure sales here. So we don't talk about sales. Some restaurants may have completely removed their physical space and just like do delivery or takeouts. But here, why foot traffic is important for us, because that restaurants who keep their physical space, they pay rent for it. So they want to utilize it first. And then second is, which is more important than that, and that is the social interaction. So we provide social interactions, and as more people we can attract to the restaurants, we can facilitate more face-to-face, discussions and probably more interactions between them and more probability of sharing opportunities. So that is why we look at the foot traffic, not sales. So of course, like there is sales data, but that is not our, focus of the study here, because of mainly the social interactions, not the restaurants itself's revenue or sales. So this is the first one. And for the second one, the census block groups are about like 10 blocks of the size. So yes, they are not like individual level, but they're not that much different, because 10 blocks next to each other, you won't see that much, differences in their, for example, like hygiene index in their, income level. And also what we do here, we have the weighted mean median income actually. So it is weighted mean of that median income. And so that is what we can do. That is the most granular data we have. We actually turned this also like into more aggregate level to the census tract and analyzed that. That was also like the same results. But yeah, I cannot say anything about individuals. But that was the best, I mean, most granular analysis we could do with our data.
Hi, thanks for your presentation. My name's Ethan. I work in the research division of the Boston Planning and Development Agency. We're doing a lot of similar work and looking at similar data. My question was, with your measure of restaurant customer diversity, that's geographic diversity. So, one restaurant has low geographic diversity. It's mostly customers from 1 or 2 block groups. Another restaurant, it's people coming from a bunch of different block groups. Is it possible that the effect that you measured has to do with some restaurants are located in central business districts where lots of people commute, and then after the pandemic with remote and hybrid work, there's fewer people commuting in, and so they suffered more than a Main Street business that has more local sort of business traffic? Did you look at, like, is the geographically diverse restaurants, are they clustered in sort of central job areas?
Yeah, so very great question. One of the things is in our model, we actually control for the number of the blocks. So if both of them have this, both restaurants have the same number of blocks, that you can compare the, the diversity. But other than that, as I mentioned in the first slide, we have another work in our group. Actually, Taka is there. You can ask from him at the end. They study this question, the second question you ask, and this is dependency of the, like businesses on the other businesses around them. So, you can see, yes, for example, maybe, what's that? Starbucks next to MIT is highly dependent on MIT. And if MIT is closed, then that Starbucks is more likely to lose most of the customers. But here, we want to, other than that, provide insights on the customers. So if I am even in a, let's say, low foot traffic area or high foot traffic area, maybe that can help me to understand if I'm doing good. So, I mean, in general, what I get from this study is instead of getting uniform customers from everywhere, it might be better to, yes, get customers from more block, but at least like a couple of them be loyal customers to you. So in such cases, you won't lose those loyal customers.
Any other questions or comments about this specific presentation? All right, so I think we can move into a broader discussion about the 3 presentations and how they relate to the other or how they don't. And that will be led by our friend Natalia.
All right, so I may be one of the few people in this region that has worked in the restaurants, summer works, youth employment, and in the planning space, but specifically around. Now they know how they fit together. It's me. We can go. No, but so as I'm thinking about all of this, I'm going to go to a totally different space where I think the connection between the 3 really are. And that connection to me is about quality of life, right? Individuals choose cities because they believe that that's the best place for them, for their growth, for whether it's economic opportunity, whether it's educational opportunity. And as I was thinking about all 3 of these presentations, we want vibrant, thriving cities. We want safe cities. We want educated cities. We want cities where it's fun to go out to eat, where we can, easily access workspaces if our home, either bores us or it doesn't provide what we need. And so I thought that thread was really woven nicely across the 3. The second piece that I thought was really important is about how important social interactions really are across these three spaces. For youth, when they go to work, the outcomes when, you know, young people were working virtually, I assume were really different than when they were in person with their mentors. Alicia, do you have any comments on that?
Yeah, they actually were not. They weren't very surprised. That's really sad. So we actually analyze, of course, because that's what we do as researchers. So when the city pivoted to their Learn and Earn program, for example, we randomly assigned young people to participate into their courses, and we followed them over time. We also followed the young people in the virtual internship program. And there's a real concern that during that summer, would young people want virtual things after a spring of not great virtual school, where like 1 in 20 kids was not even logging in at BPS? And it turned out that these kinds of jobs were actually just as impactful as having an in-person job. And in some ways they were better because they were better aligned with the career interests that the young people wanted. So instead of like showing up and doing the camp counselor job or whatever, these were kids who were doing like writing a marketing plan for a company, right? They were helping to put together a COVID-19 public health campaign and get the word out to their peers. And so except for certain things, like, so there was some sanity check where we asked them on the survey things like, you know, how improvements in like making eye contact and stuff like that. That does not improve over Zoom.
Right.
But that was sort of like our gut check of like, oh, this data is actually real. They're not telling us just what we want to hear. But they were more likely to have a mentor who told them about different career interests, help them pursue a post-secondary education track. And they got a lot of the same skills, like even, you know, the soft skills, like managing your emotions, resolving conflicts with a peer, asking for help. That all still happens over Zoom. So it's kind of surprising.
Thank you. So the you know, and I'll go back to kind of the social interaction, because even in that space, there was social interaction, right? That mentorship, that key alignment around how do we as individuals connect with other individuals in order to have kind of this high quality of life, get access to opportunities. I do have some kind of questions just, you know, that I'll throw to each of the three, and whoever wants to answer, go ahead and answer. Because I think one of the pieces that's really important in these types of topics is to talk about how, in fact, we take this research to that next level. So research happens. And then what, right? What happens after we learn what we learn, and where's the opportunity for that next level of research? Particularly, maybe I'll start with you, Mohsen, because the research that you did about and what you learned about restaurants then, right, during the pandemic, and just, you know, up until the kind of the end of the recovery of the pandemic, obviously we're still in it, but restaurants have really seen lots of shifts in how they operate today versus how they operated in 2021 even. And so I'd love for you to talk a little bit about, you know, what happens after this research, and why is this research really important?
Yeah, so getting back to the point of social interaction. So we know that restaurants are very fundamental for social interaction. So otherwise, like, we could close the restaurants at all and then order, or, you know, like buy something, grab something and eat. But other than that, you know, there are two strategies our group, you know, follows. One of them is, you know, sponsoring, or let's say hosting, you know, this events like this party, so we can get connected to the people who are actually you know, doing the work, and maybe we can interact. That is social interaction again. If we don't have this and we just like do Zoom, I don't think like the experience shows we could you know, benefit. But here we have this social interaction. We talk to each other, you know, like people from government, people from academia, people from businesses. That is one way to, you know, bring our research results to the action. And the second is we also try to, you know, build up the platforms, different platforms. So for example, we have like Atlas of Inequality, Atlas of Opportunity. And what we try to do is that we try to, you know, translate our research findings from academic language to, let's say, map-based interactive, websites. So every group of people, any group of people, let's say people who do businesses or work in companies, people who are looking for good future for their neighborhood, or government people can go to those websites, use the tools which are built off of our, studies, and that is how we want to reach, to our, let's say, main audience or target audience.
Thank you. Do you guys want to add anything?
Yeah, I would just add two things. One, I think the goal of our research project, one, is to implement the recommendations, right, that's coming out of this partnership with Northeastern University. So there's definitely a clear strategy of how we need to do that. And then in addition to that, we need to think about building the capacity, internal capacity within our team to make sure that we can continue to analyze and assess and evaluate this work as well. So I would say that. And then the quick third thing there is, and we've talked about this a number of times, is how do we share the research like on the ground level with our employers, with those folks who are doing the work, so that they can be informed of what's needed to be able to improve their work as well. So thinking about a strategy to be able to do that also.
I just wanted to quickly add to that, that institutional challenge grant is not just to support the partnership that we've had for a long time, but to build that capacity, not just in the city, but also build the capacity to do this kind of research within the university, right? And so that's where that city to city initiative that I was talking about, that's what it's doing inside Northeastern, is to provide faculty with the training, the coaching, the mentoring to be able to form these research practice partnerships, because we didn't just get data, go away for a year and then come back and present it to the city. We meet every 2 weeks. We talk through what are the research questions that the city needs to have answered, right? My first research questions were around, is this thing impactful, right? So we did do that. But the second set of research questions is this program operating in the way that we think it is, or the way we think it should? And we co-created that research agenda together. And then we talked about how are we going to collect the data, right? In terms of not just the data we could pull from their system, but also the surveys that we run with young people, the kinds of questions that you ask people. It's important to know like their positionality as well as your own, right? And then finally, how do you interpret those, the data that you're getting in the findings, right? So a lot of times we bring to Rashad's team, hey, did you see this? Look at this trend. They'll be like, yeah, well, that's because this employer dropped out that year, or we changed the way we assign jobs, right? As an academic, you can get this so very wrong if you are not talking to the people who are on the ground and doing this lived experience day in and day out. And then even how you interpret those findings, right? Like nobody wants to hear that there were jobs that were, not filled with young people at the end of this matching process, right? But at the same time, like when you uncover the why, you're like, oh, it's so obvious. Like if young people only applying to one job and like 350 of them apply to the same job, that's like, 320 are unemployed right off the bat, right? But the way you interpret is super important. And the last thing I'll say is when you form that kind of partnership, then that's how research evidence gets used, right? Because if we just come out of nowhere as academics with data and information and, you haven't had a partner who's helping you interpret that or have skin in the game, right? Then it's really hard for them to wrap their heads around it and want to use it, right? But, Rashad has been a partner all the way along and has contributed to this process. And so he can trust, right, the findings that we're bringing to him because he knows where they're coming from.
Yeah, so as I mentioned when I was going through my presentation, this is very early stage research. You folks are actually pretty much the first people to ever see those results. I just showed it to my advisor yesterday, actually. But we are working through, one thing that my group does really well at MIT, I think, is that we really focus on who the stakeholders are for our research. So I mentioned that at the beginning, we work a lot with transit agencies. This doesn't necessarily apply to transit agencies specifically, although I would argue that, building some of these remote work hubs at transit hubs might be really helpful for transit agency ridership. But we kind of stepped back and thought about, do we have any connections to people who might actually be interested in this research? And so recently we found out that the Urban Land Authority in Singapore is actually trying to sponsor some of these shared workspaces across the country there. And so we've become connected with them, hoping to share our results with them and perhaps use this to inform sort of smart location decisions rather than some of these more just scattershot decisions that have been made by other jurisdictions who have tried to implement this in the past. So it is definitely something that we're thinking about, but sort of a little early to start actually sharing it at this stage.
I have so many follow-up questions for all the projects, but I'm not going to go there. I'm going to ask another question all around because everything is a funding issue, right? The reason we can't have what we need in our societies is because there's not enough capacity and not enough money. So I'm going to ask the question, if funding was not an issue, do you believe that you could just resolve all of the issues that you're presenting in your research? We'll start over here.
Sure. So I'm going to say no. And the reason is the one extension of this research that I was really hoping to do once I'm done with sort of the mathematical modeling is actually looking at whether zoning is preventing this from happening at all. So my hypothesis is probably that it is. There's a lot of places that are only zoned for residential uses where it would be impossible to actually build a remote work hub somewhere. So I think there are also sort of regulatory and land use challenges in addition to funding that would come into play here.
And luckily the BPDA is here and the zoning issues, particularly in Boston, are, a great example of how, it's not just funding, it's not just capacity. There are some underlying issues that really impact our communities regardless of kind of what we want to see come out of it. Turn it over to you guys.
I would say funding could really address probably about 70% of the challenges that we see within the Youth Jobs Program. One of the things that we feel will be truly instrumental is investing in a youth jobs infrastructure, that could essentially serve as a single entry point for any employer that is connecting and employing young people. Because the application process is managed by each individual ecosystem partner. And then with our grant process, as Alicia mentioned, now each of our nonprofit partners are also managing their own application process, right? So that does make it really complicated for young people and families, that are trying to navigate how to apply to jobs, and if they're, if they don't get into this type of job, where do they stand with another employer, that has a different application. So an infrastructure that can be a centralized entry point for young people is something that, we're hoping we can continue to have conversation around. It can gain some traction and find some funding for it. And then attaching like a learning management system to that infrastructure as well, so that, within that young people can track the skills that they're learning through these jobs, that can help form an electronic portfolio, right, that they can use that's transferable to employers as well. So funding can help out with a little bit of that.
Yes, so usually my research is focused on providing insights for decision makers so they can make informed decisions. So it's like either like they're like people in different communities, or let's say government people or business owners. So we just provide insight and say like, hey, if you continue like this, or if you are doing this, this is likely to happen. Now decision is yours. So it is not dependent on funding, but for example, like, okay, your neighborhood is not healthy. Why? Maybe you don't have access to gym. And that is not, that is the people should demand the government, and then government should respond them. So I cannot say like if that would help with everything, but not related to my research. Funding can help most of the problems.
So we're about to wrap up. So I have to talk about the private sector, right? Because one, I'm representing Eastern Bank Foundation, and two, small businesses make up 80% of the economy. So employers with less than 50 employees, but particularly less than 5 employees are the majority, is the biggest bulk of our employment. And I see a lot of restaurants in that space. I am thinking about the market solution to the co-working space, right? I'm wondering if coffee shops and other, small spaces that could be converted into, third spaces. So if a restaurant only opens at 5 during the day, could it open as a co-working space? What does that look like? And then thinking about specifically for, placement for youth, how do you engage with young people as a small business owner in your main streets to ensure that, that there are enough jobs, that they're local, that they're, continuing to be run and the engine behind them to be local young people. And so my question to all of you to kind of close out this panel is, what is your ask of the business community and how can you engage them in your work?
So I think like I found the right person. So so most of my studies are highly related to small businesses. So yeah, maybe through connections like you, we can get connected to the small businesses. But on the other hand, as I said, like we are developing tools and insights for a small business owners, so they can use those tools online for free, and then have more information while they want to make decisions. So this is how we are going to support them. I mean, let's say, and then we also like small businesses to trust academia, and yeah, which is a little bit difficult.
One of the recommendations we didn't touch on, because this is pretty lengthy report and there's lots of recommendations in there, but one of them is aligning the jobs in the Summer Youth Employment Program more with the sectors that are in high demand across the city. So some of this happens, right? There are some jobs that are in healthcare and some that are in the life sciences, but not as many as those that are like in the daycare, the day camp, the nonprofit sector. And so that's something that takes a partnership with the private sector, right? To be able to bring those jobs, not even into the program, but even back into the program, because a lot of those jobs were there before the pandemic, right? And then when the pandemic had really disrupted a lot of those kinds of opportunities. And I guess I would say a sector that we're trying to bring into the Summer Youth Employment Program this year is the 4-year higher ed institution, right? So Mayor Wu has set a really ambitious goal of employing 1,000 additional young youth this summer. And coming up with those additional slots is not easy. So Northeastern's actually leading a sector of higher ed institutions, including BU, BC, Tufts, UMass, Harvard, to employ young people this summer. So at Northeastern, we're bringing 125 young people on campus to employ them and expose them to a 4-year college campus. And if any of you want to ask MIT to please come along with us, that'd be great. Or think about it for next year, because, this is certainly a place where we think that there's a gap, right, between what happens, in the ecosystem here in Boston, between the opportunities that young people have for work and what they have for post-secondary opportunities.
Yeah, you mentioned the restaurants opening early for people who want to do remote work. And actually the restaurant Shybird here in Kendall Square, you can buy this sort of like remote work day pass thing where you can hang out there all day and you get like a discount on your food and drinks. So we're starting to see that happen a little bit. But what I would ask of the private business community is to start thinking about investing in underinvested communities for these remote workspaces, right? I showed the map where all the co-working spaces are today, and that doesn't give a lot of great access to people in underserved communities. So I think that that's something that the private sector could take some leadership on. I think they might be surprised at how much demand there is even in underserved communities for these remote workspaces. So that's probably where I would go with that question.
Thank you. Well, I thank you all for your research, for presenting it to us today. Lou, thank you for your leadership today and always. And thank you all for listening to us. We'll stick around a few minutes if there are additional questions and anyone wants to hang out or whatever. Good to see you guys and enjoy the rest of the conference.
Get started in just a minute. This is the panel discussion on co-designing green spaces. And we're super excited to have folks here. My name is Mira Deanne. I am with the Boston Planning and Development Agency. I'm the Deputy Director of Design. And we're thrilled to have all of you here. So I'm going to introduce the panelists. We have 4 panelists today. We're going to each give a short presentation, and then we have a provocateur here who will help us kick off the discussion session. So our first speaker is Taylor Leonard with the Charles River Conservancy, who will be speaking on community-driven data collection.
Right. Hello, everyone. My name is Taylor, and I'm a little bit breaking the mold today since I will be talking about co-designing a blue space, which also kind of works into co-designing a green space. So again, my name is Taylor. I'm coming from the Charles River Conservancy. My role there is really in community engagement. And so I'm excited to talk about data in a way of, a small nonprofit and kind of what we can accomplish with the resources that we have. So the Charles River Conservancy is an organization that works closely with the Department of Conservation and Recreation. With that being said, we work along the Charles River, both bringing access to the river all the way from North Point to Watertown. And so we really strive to make the river and its parks kind of a well-maintained public space. Essentially being urban places where we invite everyone and we try and engage specifically with the water, creating open access to the space. We will be talking about our floating wetland initiative, which on the bottom left-hand side of the screen, you see these kind of growing plants floating along the water that can actually be seen over by the Broad Canal in Kendall. And of course, our mission when we first began our nonprofit was to bring swimming to the Charles River. And so one day a year, we do invite the community to come swimming because that is kind of a mission that drove us to this floating wetland project to talk about it as an ecological intervention. So that is why you see people swimming in the river. It's not alarming. We do test for that one-day event a year, but it always is good fun. So this is what the Charles River floating wetland looks like when it is in full bloom, an image from summer 2021. Right now, if you visit, it looks like the start of a garden. It's pretty sparse, but it will become full bloom. And like I said, this is a project we'll be mentioning when we talk about projects like this that are on the water, particularly eco interventions. This is, of course, a pilot program that's taken place over the last 3 years with a lot of scientific research that's been filling in, but we really value partnership, specifically, collaboration, trying to get others to enjoy and spend time by the parks. And so rather than talking about the preparations and permitting, which took place with some stakeholders and technical design workshops. And then also we had the 3 years worth of preliminary scientific data that took place with our research partner from Northeastern, Max Rome, really wonderful, kind of kickstarted this project. We're going to be focusing on the engagement side of data and what that has looked like for our organization as we move from a pilot program to a future possible expansion of this floating wetland project. So with community engagement, we're actually going to be taking a unique look at our youth engagement and how we've been able to kind of collect co-design data with local youth organizations. So generally our process, we like to look at it as kind of an infinity wheel with some decision-making outputs. So the Charles River Conservancy is constantly talking with local partners, that be stakeholders, DCR, the Department of Conservation and Recreation, the landowners whom we work with, of course, the community. And we loop that all together. Sometimes the meetings are individual, sometimes they come together. And then through that, we have an evaluation process, bringing kind of lead partners from each category together to manage our decisions. we are looking at an expansion design for our floating wetland. Some examples include other groups like the National Aquarium in Baltimore is the top left image. Top right is the Wild Mile in Chicago, kind of an expansion of what floating wetlands could look like on the water in a larger space. But before we move from our 700 square feet to our expansion, we need to know what in fact we are designing for. And that's where we started working initially with the Cambridge Mayor's Summer Youth Employment Program. The three I'm going to highlight today also include the Cambridge Youth Program, specifically the Frizzoli Center, and the High School Extension Program, part of Cambridge Public Schools. This is not a full inclusive list of our organizations that we've partnered with, but a few highlights. So specifically with the Mayor's Summer Youth Employment Program, really wonderful. We worked with this cohort of teens, and we actually had teens kind of create an intercept study. And so they spent time on site by our floating wetland for about a 6-week process. And in that 6 weeks, teens developed a series of questions that they were going to ask to the community about the floating wetland, what they thought of the floating wetland, what maybe an expansion of the wetland might look like, what the community wanted to prioritize during that time. And so by spending just ample amounts of time on site, these teenagers were really brave, and they were able to talk with community members, cataloging, anecdotal responses about the wetland, whether they knew it or not, and actually took that information and aggregated that data into these physical models or designs that you see on the top right-hand picture. So actually that is a kayaker, and then it is an example of a floating wetland with a dock system below it. And so that's something that the floating wetland does not have at the moment. It does not have a dock system. It was also in a particular U-shaped design that was made to kind of include alcoves for on the water recreational users to go and join the wetland. And so I'm mentioning these as some trends that we're seeing through this collection of youth data that we'll continue to see as we filter through other groups. Another program, having kind of worked with the Mayor's Summer Youth students, it was a really wonderful display of what the community is speaking to. And so we decided to work again with another group of a similar age range, the Cambridge Youth Program at the Frizzoli Center. They actually developed and conducted a study specifically about the floating wetland, mirroring a number of the same questions that the Mayor's Summer Youth Program students had, and were able to collect. Here it says 53 responses since the image, a few more came in, a little over 57 responses from their particular community about the floating wetland. And in a presentation back to the Charles River Conservancy, they noted that half of the community members surveyed had lived in Cambridge for 11 plus years, and they consider this group experts on the community. Now, what I love about this is in their study, 11 plus years might have meant that you could be 13 years old. And so what's really incredible by kind of leveraging community data and having teenagers also work to collect data is you're learning how they identify themselves in a space. And we love that youth are identifying themselves as experts in their field. And that's giving us an opportunity to leverage that voice and amplify that voice when it comes to our evaluation periods across our scientific, youth, and kind of stakeholder charrette data. This is a page from some of the results. I'll call out specifically free public Wi-Fi and charging stations, which you might not always connect directly with more an on the water green space or blue space. Maybe in terms of a park bench, that's wonderful. But when we think on the water, we think swimming, which is, this intervention of the floating wetland. And so public Wi-Fi is something that youth are able to tell us, okay, this is really valuable and we need to take this into consideration as we move forward. And this also became kind of a through line as we were talking with these community groups. Next, we visited and held design sessions with different partners. One in particular being the high school extension program, part of Cambridge Public Schools. So design sessions looked like taking a lot of those questions and physically drawing out aspects of design that we would value in a future floating wetland. I'll call out these few that really stood out. We were talking about forced family fun or family experiences as being what was tied to these blue spaces or public spaces. So noting that space for family rather than individuals was not only valued to, those who are talking with stakeholders, but to see that family fun is being valued amongst teens, even if that is forced, was a nice connection point there. We also are seeing things like colored lights and then charging stations kind of mirroring that trend of free Wi-Fi and charging stations once again. And so the way we were able to pull in all of this information specific to our next steps in our expansion project was through a Miro board. And this is a snapshot of a Miro board where we pulled in our researcher, Max Rom from Northeastern, who's doing the scientific research over the pilot program for 3 years. We had our architectural designers. So we worked closely with Perkins and Will to develop some renderings that showcase kind of what the future expansion project could look like. We had our connectors, the Charles River Conservancy, who have been part of this work. And then we also had a community organizer that was part of one of these youth programs that we had been working with. And so by putting us all into the same room over a couple of hours and few meetings, we were able to take the research, design, community, and connection parts of this data and really dive into a sprint. And we have different areas, like on the left, we were talking about vision. We had vision and goal setting that we were talking through. We also had, our engagement all listed out visually that we could reference and kind of pull in these notes. So by the time we're working towards these renderings, which is the placement that we are at now with our expansion project, is the development of these visuals, we can pull in these through lines of youth perspective trends. And so looking at this rendering, it's really beautiful, showcases a real extension of what 700 square foot floating wetland could look like across the entire broad canal. But what was really valuable to us was looking at how to create this space. So moving beyond kayakers, we have the stairs that showcase where you could have that forced family fun. We're calling out families that are together. I highlighted the two teen groups in the center. They're actually looking at their video games and looking at their phones. And this may seem small, but it's really valuable because we're blowing up these images, we're putting them on boards, and this is what's being sent to those who are gonna push go on this project. Investors, our partners, our larger stakeholders that are going to be driving this forward financially. And so where we can bring this data to improve our representation of our project, we're going to do so. And one rendering may have been enough, but we didn't feel that was true because we're missing trends like lighting. And so when we move forward, we also really advocated as an organization to have other renderings created like this one here, where you can see again this model that was designed by the Cambridge Mayor's Summer Youth Program teens. That white pipe cleaner right in front was a representation of lighting along the edge of the wetlands. And so it was really valuable to us that we were following those trends. And here specifically, you can see lighting along the floating wetlands that really make for a standout rendering that really advocates for the expansion of this wetland and this co-designing of a blue space. And so these are where we're at now as we move forward with the project and generate more interest about what could be. And we're really excited to continue to work in this community feedback loop and take these renderings, bring them back to the youth and say, we're really excited. This is what we have. What do you think? How can we improve and continue to move this forward? Great. Thank you.
Thank you, Taylor. Our next speaker is Lydia Lowe from the Chinatown Community Land Trust.
Good afternoon. Oops, I guess I talk loud enough anyway. So I'm going to talk less about methods of co-design, and I'm going to talk more about co-design from my perspective as a longtime community organizer and how I see the interaction of design and organizing. And so to start with, I'm going to go through a little history, which some of you may already be familiar with, but this is a picture of Chinatown back in around 1860. And it shows that there was a continuous community, predominantly immigrant working class community, not mostly Chinese at that time, but you see a lot of little streets there, residential blocks. Oh, okay, but yeah, all right. But then in the 1950s, we started having urban renewal and highway construction, first of the Central Artery, and you can see how that sort of chopped off a piece of Chinatown to the east. And then we had the construction of the Massachusetts Turnpike in the 1960s, and you can see how that chopped the community into more pieces. Next, we had institutional expansion, particularly New England Medical Center and Tufts Medical School, later followed by other universities. And then we had the city decision to make the west of Chinatown the city's only adult entertainment district, which forever had an impact on crime and other problems in Chinatown. And finally, followed by the most recent trend, which everyone's probably familiar with, which is land speculation and the influx of luxury housing. So why do I start with this when we're talking about co-designing green spaces? It's because it's being rooted in this history and this long history of injustice that really motivates me and motivates a lot of people in the community to participate in community meetings and events. And so when we look at planning and thinking about the community, of course, we're concerned about, all aspects of community life and all aspects of planning. But it's important to always ground ourselves in that history and in that reality when we think about, like, how did we get to where we are today, where there's only 10% of tree canopy coverage in Chinatown, where, Chinatown is both one of the most vulnerable neighborhoods to flooding and the hottest heat island in the city. We didn't get there for no reason. So when we began a planning process, which we called Chinatown Master Plan 2020, this was sort of our perspective. And of course, the planning process, we involved a lot of different activities, involved community meetings of different types, charrettes, walking activities, and street activities. We had different focuses, nothing too unusual compared to other planning processes, I think. But of course, we did incorporate a variety of activities. We worked with artists. We did some activities at street fairs. We had events in a park. We had lots of people involved in these different activities. But I think that what's most important and unique was not necessarily the type of activities that we did, but it was our awareness of what we were trying to accomplish. with this planning process. And always on our minds was the knowledge that the city was engaging us in an official planning process called Plan Downtown, which included Boston Chinatown at our request, because we felt that it was important for us that whatever the community was involved in planning, we didn't want to just be something that sat on the shelf. We didn't want it to be something that only the community acknowledged, but the city did not acknowledge. And so for us, Chinatown Master Plan was a deliberate organizing tactic to engage the community in a planning process that we had control over, but which would run side by side with the city's Plan Downtown Boston. And therefore, it would enable the community and kind of empower the community to have a stronger voice within Plan Downtown Boston while we fully participated in that process. So we asked ourselves, questions like, what does it mean to have a healthy community? What makes Chinatown Chinatown? If we say that we want to stabilize Chinatown's future, what does that mean? How do we stabilize our immigrant working class families? So those were some of the questions that were foremost in our mind. And again, I think that, what's unique is coming from the community lens. In a way, we weren't thinking about ourselves as designers or planners. We're thinking about ourselves as, as organizers and as part of a struggle for justice. But that doesn't mean that we're not taking the planning seriously, because we are thinking seriously about how we affect our reality in the future. Oops, did I skip something? No. So this led, the master plan process led to a lot of different activities and many different focuses, including a focus on open space and some of the, oops, little typo there. Some of the focuses that on open space, which came out of the process for us, was a particular focus on these several open spaces: Reggie Wong Memorial Park, which is the community's only public open recreational space. We became involved in an effort to gain community control of that park for the purpose of securing its future and making sure it did not get redeveloped when Mass DOT was planning to sell the land to the highest bidder. Deciding together with other agencies that it's a priority to us to take a space known as Phillips Square, which had become I forgot what the term is, but it became like a short-term experiment in creating public space out of a wide street. And we want to take that to a more permanent phase. Becoming involved in looking not just at how we activate space, also how we improve and expand space, how we give residents access to spaces elsewhere outside of the community, and access to gardening, which is very important to many of our residents. And finally, working long-term to create a park that's really needed in the future permanent Chinatown library, which we spent 50 years fighting for. We're about to get a library. There's no green space plan next to it, but that's something that we're working on. So I think I guess some of the lessons to me from our planning process are that the importance of grounding ourselves in that community perspective, that there's a partnership between those who are professional planners and what they bring with people who come from a community perspective. And in a lot of ways, we didn't have to be the ones who thought of the most creative ideas for how to do the planning process. But we were actually very happy to participate in a lot of the, creative processes that were proposed to us by Plan Downtown. But unless we're involved as an organized community, I feel that those planning activities would have fallen flat. And I think the other thing is really listening as you talk to people, whatever the activity is and whatever the venue is, because things will come up that you didn't expect. And that's how we got into the direction of looking at public spaces. We got into issues like parking. We need a comprehensive plan for parking, which really wasn't one of our priorities. And we got into developing a cultural plan for Chinatown out of that discussion about what makes Chinatown, Chinatown. Thanks.
Thank you, Lydia. Our next speaker will be Milan Chutani from Vital Villages Network at Boston Medical Center.
Hi, everyone. It's great to meet you all. My name is Milan Chutani. I'm joining from Vital Village Networks at Boston Medical Center. We're a nonprofit network of families, parents, community-based organizations, and researchers committed to maximizing children's well-being. And this opportunity is to share around the data storytelling workshops that were community-led through our organization. This session is about co-designing green spaces. And to do that, the two things that are absolutely critical to get right are having data that reflects community experiences and building deep trust and engagement among residents, government, and researchers. So today we'll think about data broadly. At its core, data is wisdom that reflects a facet of someone's life, whether it's from a national census, patient data at a hospital, or narratives, photos, and videos. We're actually not going to talk a whole lot about green spaces today, but instead we'll focus on these two underlying principles. How many of you can think of a moment where you heard about research or a statistic and realized that they were talking about you or a loved one? How did it feel seeing it? Do you remember how it was framed? Maybe you felt shock or relief or hope. Data can be validation, and when it's framed from a strengths basis, data stories can empower and build coalitions. Missing data or data framed from a deficit basis can make entire community efforts to address challenges feel isolated and invisible. And so problems arise when people at the center of research, often African-American, Latinx, immigrant, differently abled, or LGBTQIA communities are not the ones framing and sharing their own stories. And so here's a quote from my colleague, Suzette Dundyer. Suzette is a Vital Village member and a workshop participant. She's also a social worker, mother, and tenant organizer, and has implemented trauma-informed programs in Boston for 2 decades. She says, "We often hear how our communities have the highest levels of obesity, chronic disease, and violence, but what they don't talk about is the strength of our communities. We are resilient people who passed on and continued knowledge systems. Adopting community data storytelling as a tool that is very aligned with our roots and culture is the starting point for identifying successful interventions for public health. We see our neighbors as our first public health practitioners." In 2022, Vital Village began hosting data storytelling workshops where community members could meet other social change advocates, direct service providers, resident leaders, other parents, and learn tools together for visualizing and sharing data stories that amplified their experiences. So today I'll walk you through the ways that we structured the workshops and its inspiration. And you'll also see examples of community-driven data stories from my colleagues Cassandra Laughlin and Katia Powell-Laurent, focused on food justice and Black maternal health. So let's start with Cassandra, who will share a little bit about her mapping tool that has rallied neighborhood support for a grocery co-op and community farm in Augusta, Georgia. Cassandra is a food justice advocate, farmer, and founder of Goodness Gracious Grocery Co-op. She's a member of the 2023 workshop series.
We are using data to address urgent issues affecting our historically African-American community in East Augusta. Our neighborhood has been slated for development, transforming it into Augusta's second waterfront. Many of us in the community will be forced out of our homes to make way for this new project. On top of this pressure, we face the challenge of food apartheid, as our neighborhood lacks access to healthy food and grocery stores. In the data storytelling workshop, my neighbors used felt as a tool to map out the lack of options in our current food landscape. We were able to illustrate the challenges of going outside of our area to shop for food. Traditionally, data has been used against us as a tool of oppression, creating a false narrative that we simply do not care about our health. When we created and shared data collectively, it told the true story. We simply do not have the means or options for healthy food choices. Our community-centered, data-driven solution is Goodness Gracious, a community-owned grocery co-op that offers fresh, affordable, and healthy options. We aim to increase the availability of healthy food by partnering with socially disadvantaged farmers and up-and-coming food entrepreneurs. This cooperative will serve as a place where everyone can come together to share and build community. Engaging with community members to identify research questions, co-designing research protocols, and involving them in data collection and interpretation made for a more inclusive and successful outcome. Data became a tool for liberation for our community-centered development project. Thank you.
So if you haven't used Felt before, it's kind of like a Google Doc for GIS, where anyone with the link is able to add to a map. If you click on locations in Cassandra's map, you'll see dozens of quotes from neighbors sharing their experiences buying food and advocating for healthy options. Teens traveled around the city on their school break, adding the data that you saw around transportation times and grocery costs. Cassandra says, for our neighbors who have contributed to the Felt map, it has been a powerful experience feeling heard and seen. It has validated their thoughts and feelings and helped them realize that they're not alone, and has led to a greater sense of community engagement and empowerment. Cassandra shared her map with her district's councilman, raising awareness about food insecurity and galvanizing support for her neighborhood's grocery vision. Residents in the next district over also saw the map and realized they had the same issues and are creating a tool to advocate for similar challenges. 31 people like Cassandra and Suzette have participated in the workshop series across 9 sessions and 22 office hours. 48% have attended 2 or more times, and participants range from 14 US states and Canadian provinces. 45% are from the Boston area, and about half have participated in other Vital Village leadership pathways. We structured the workshops to be 4 90-minute monthly meetings. These included topical discussions, technical tutorials, often led by previous workshop participants, 30-minute case studies where participants shared their own data challenges and projects and refined their ideas. Group and one-on-one office hours also allowed for deeper dives into tools like Mapbox and Google Data Studio. The workshops were structured with community leadership and empowerment in mind, which are grouped here. And alumni facilitation was really well received. For example, my co-author Katya, who you'll meet in a little moment, participated in the workshop in 2022 and rejoined to teach the Night Lab sections in 2023. Participants also found that the Indigenous digital cartography and BIPOC data leadership materials were especially empowering. So here's a scale of community engagement. Some of you may have seen this before. The left is where people are informed and maybe consulted about research. Our workshops are trying to move to the right towards empowerment, where the tools to define what data is valuable and to share this data are ultimately in the hands of community members. These are some of the tools that we use for GIS and spatial data, tools that are taught through different office hours and workshop sessions. And here's an example of a GIS data story designed by Marianne Buggs in Vallejo, California. This tool is open sourced and developed in Mapbox and allows community organizations to crowdsource food, housing, and social resources through an accessible Google Sheet. And this was one of the first experiences Marianne had with GIS and mapping for social change. Beyond mapping, there's a whole range of other tools, all free and available online, that our participants are using and teaching and learning from. Free audio and visual data journalism services provided by Northwestern, community annotated maps and toolkits, population health databases. We're especially grateful for BARI and the Boston area research map that you all provide publicly for Boston area participants. Participants also highlighted several challenges around accessing data, especially who has the means to access results that can help communities in programmatic changes, and also what honoring intellectual contributions of community members should look like. We may need to cover some of these other ones in the Q&A in a moment. For now, I wanted to share a second case study from my colleague, Katya, who uses data tools to reframe historical trends and highlight which experiences are valuable. Katya is a birth doula, mentor, and founder of Black Girls Nutrition. Black maternal mortality is a crisis in the United States. Black mothers are 3 times more likely to die from pregnancy-related causes as white mothers. Katya created interactive maps and timelines that highlight how these health disparities are rooted in legacies of structural racism. Her work also elevates joyous birthing experiences, social movements, and legislation, which offer hopeful paths forward. Katya shares her timeline with clients, which helps them see their own experience in the broader context of Black maternal health in America. The timeline has also been shared with policymakers to advance maternal health equity. And I know we're here to plan and discuss planning physical spaces. So when you're watching this video, think about how residents in your communities might use a similar tool to tell the history of neighborhoods, like in Chinatown or along the Charles River waterfront. What would it look like if they were using this tool to tell it in their own words?
My name is Katya Bowman, founder of Black Girls Nutrition, birth doula, and a partner of Vital Village Networks. During one of the data storytelling workshops, I wanted to create a timeline that shows that despite transdisciplinary knowledge, research, policy, and advancements in both medicine and technology, Black mothers and babies still experience the highest maternal mortality rates in the United States. There is so much power in data, and this timeline is for all of us that want to advance data-driven research and policy for Black maternal health. On this timeline, you will see content in the following areas. Adding data to the timeline has been such a powerful experience for the women and families that we work with, as well as our colleagues in both research, medicine, and/or policy. We cannot overlook that the advancement of many areas of medicine were built off the experimentation of Black people here in the United States. Take Dr. Sims, he's considered the father of gynecology, but he performed unethical surgeries on Black women. You know, it's not just about collecting data. We have to remember that each number is a metric that represents someone's experience in life. And just like my colleague said, data is validation. These are urgent issues that require immediate solutions, and we can't wait for policy change or research to be conducted, analyzed, and/or published in a journal. There are non-traditional solutions that are already addressing these issues. And we need to learn more about these initiatives and build connections with relevant stakeholders. By doing so, we can contribute to and benefit from the efforts to improve these critical issues. That's why we need to tailor our research to the communities that we serve. We need to be humble, learn, and immerse ourselves in the community. It takes time, but it's totally worth it. And that this event today is not just a one-time event, it's a longitudinal engagement. It's about building relationships and working together to make a difference. I hope this was helpful. If you have any questions, let us know. Thank you for your time, and thank you for being here.
So in conclusion, I want to leave you all with a call to action for a research community to support community data storytellers. And this can look like sharing technical tools, data storytelling opportunities, data itself, all of which are needed to collect, store, and visualize knowledge and use culturally appropriate and strength-based approaches. Ensure that people who are most affected by a challenge are active participants throughout the whole process of research, from designing questions to visualizing solutions, and measure progress as defined by community members, which can help foster trust and engagement. So thank you very much for listening. If you're interested in any of the projects, the contact information is up here. And if you're interested in joining the summer data storytelling workshops, please reach out.
Our final presenter will be Erin Greiner of Culture House. who will be speaking on breaking free from the community meeting.
No. I think this is just she allotted. All right, thank you very much. So my colleague Rishika was meant to speak today, but unfortunately she's not feeling well. So I'm filling in. I hope I'll do her work justice. Want to talk today about breaking free from the community meeting, how our group Culture House co-designs equitable public space using interactive engagement. So I just want to first start with giving some setting of what Culture House is. That's our organization that both Rishika and I are part of. We are an urban design nonprofit that improves livability in local communities by transforming underutilized space into vibrant social infrastructure. Essentially, we work with communities to make cities more healthy, more livable, more vibrant, more sustainable, and more equitable. Across our work, we see three key high-level impacts. First one is crisis resilience. So we really focus on work that creates environments that spur the necessary networks to create communities that can be resilient in times of crisis. Secondly, we see key impacts around livability. So infusing play and social interaction into the fabric of public life, we can create cities that are happy, healthier, and more livable. And lastly, we focus on our third key impact area of equitable community development. So really using a participatory placemaking methodology to bring communities together to self-determine the future of their own neighborhoods. So I want to talk today about a particular project that we worked on last year and use that as a way to walk through the way that we collect community data. So that project is Olmsted Now. Olmsted Now was a program run by a group of partners and led by the Emerald Necklace Conservancy as part of their celebration for Frederick Law Olmsted's 200th birthday. And this program, which ran over the course of last year, had a particular element that was called Parks' Platform, which was a series of events over about 6 or 7 months that took place in parks across the Emerald Necklace. And we worked with the Emerald Necklace Conservancy to assess whether how the events were meeting their goals around shared equity in the parks, shared power, and increasing access to the parks. So in order to actually understand and in order to actually evaluate how these events met those goals, we used a series of data collection methods. So we started off with pre-event data collection, and the methods that we used during this phase were doing engagement with the Conservancy, with all the partners that were at the individual events to really understand what their goals were in doing these events. We asked questions like, what's your ideal day at the park? You know, trying to understand how they were viewing parks and therefore what change they might expect to see during an event. We also collected basic baseline research, including looking at available area census data and other kind of large data sets. And additionally, we rounded out with observational data collection in the parks themselves to give ourselves a baseline understanding of what the existing function of the parks were. So I want to just bring up this quote because I really think it really speaks to the importance of data when talking about public space and talking about parks. BAMS Fest, which is one of the partners for one of the events during Olmsted Now, Catherine said that they're a fan of research because it's what drives their funders and sponsors, and it shows them they were all fighting by showing them the impact of the events. So really when we think about data, it's not just about what we as researchers can learn, it's also about what people that are actually doing these events, the usefulness that comes from data in terms of telling their story. So the goodies of our data collection really happened during the actual events themselves. There's 2 primary categories of data that we use during these events that we generally use across our work, and those would be observational interactive data. So starting with observational data collection, There are 4 primary methods that we used in this project. The first is field notes. So we just went out and we observed, we tracked patterns, we talked to people, we interviewed people, we overheard conversations, and that gave us a lot of anecdotal context and evidence for what we were seeing. We also took observational demographic counts to look at perceived demographic information in the parks. In public spaces, the way we're perceived has a large effect on the way that we feel comfort in a space. And so by tracking perceived demographics, we were able to get a sense of what was the overall feeling of safety and comfort for various people in the park system. We also looked at activity mapping. That's what you're seeing on the left here. A group of volunteers went out and actually tracked during the park events where people were sitting and staying or standing, and how did that correspond to what the activities that were happening during that event. That really allowed us to get a sense of how the function or use of the parks changed during these events, which were designed, again, to increase access and increase function of the parks. And then lastly, we looked at who was interacting with us, who was actually interacting with our data collection methods that I'll be over in a moment, to get a sense of actually the number of people that we got to engage to this project. So I want to put up another quote here from Jen, who is at the MLX Conservancy. I really think she said it well, which is that when we're talking about data collection, it's all about turning it from an interaction into an interaction rather than a transaction. When we talk about community gathered data, a lot of people are really over surveyed. People are asked for data a lot and don't always see results from that. And so our focus is really turning the community engagement process from an extractive process into an additive and a supportive process. All right, so now we're into the fun stuff. I'm going to go over a couple of different methods of interactive data collection that we used during Olmsted Now and again across our work at Culture House. So the first is a sticker map. So when we talk about location data, we put up a giant map. We had people put stickers from where they were coming from that day. It's a little hard to see in the photo here, but we actually designed a map that had a blow up of the neighborhood we were in, and then a much more sparse regional map. That allowed us to get quite a big range, both a macro sense of location, but also a much more micro sense around the actual park itself. And this is a really helpful tool that we ended up using to be able to categorize certain parks as being parks that were attracting much more of a local audience, much more of a regional audience. We also asked questions about certain quality criteria, again, using sticker voting as a good interactive way to get people to engage with the data. And so we asked, how do you feel about the park? And we had 6 different criteria. Is it comfortable? Is it accessible? Do you feel safe? Is it memorable? And asked people to rate that either yes or no. And got really interesting data from that to actually see how people experience the park. This is one of my favorite forms of data collection that we use, which is a prompt and open response board. So we used this chalkboard across many different events during the Olmsted Now program to ask an open response question. And we asked a variety of questions from what's your favorite thing to do in the park to, what's your favorite park? What do you love about the park? And we got really interesting data from that, interesting responses, but it also provided a moment of interaction. You can ask kind of whatever question you want. People just put what's on their mind on an open response board, but we actually encouraged that because we wanted to see how people responded to a more open question. Another tool that we used is rather than kind of asking a survey question, we designed this ball voting system. So we had 2 tubes, and it's almost like if you had a coffee shop, it's like a tip jar for like dogs or cats. We supersized that and turned it into a question about parks. So we had these ball pit balls and these clear plastic tubes. And during Olmsted Now, we asked the question, have you been to this park before? And have people put in either yes or no. And that gave us a much more interactive way to ask that question. We got really interesting data from that. The one caveat was that sometimes got a little too fun, and sometimes, especially kids, turned into a game of how fast can I fill the tube up. So we had to track down the fraudulent votes so we could subtract those from our data later. And then another tool we used is voting chips. So kind of similar concept to the voting tubes, but really focused on a question that had a bit more broad answers. So we have these series of colored bingo chips down below, and then a little frame that you drop one into depending on your answer to the question. We used this tool during Olmsted Now to ask how people found out about the event, whether it was a flyer or an ad, word of mouth, was visiting, a friend brought them, social media, which gave us really clear data and interesting data into really understanding what was the reach of the event. Did it attract new people? How did it attract new people? And gave us ways to recommend future focuses for the organization for Elm Next Conservancy. One thing I love about this data collection tool is that when you're actually using it, you get a sense of what other people are saying, but you don't have an exact idea. It kind of forms this mosaic in this frame of the results. So you might see there's a lot of red going on, a lot of yellow, but you're not really counting it. So you can see what your community is responding, but you aren't necessarily being as influenced by exact numbers. All right, so that's kind of the wrap up of most of our interactive data collection. Another quote I want to bring up here is, we asked about accessibility during that quality criteria question, and think about the impact of what questions you ask. You're talking earlier about, have you ever seen data that somehow referenced or represented you? I think it also comes about questions too. When you see a question that is about your life experience, especially if you aren't often asked to include that in a public data situation, it can be a really powerful tool. So we had one person who said it was really great that we actually asked about accessibility in the park. That's not something that actually they had been engaged on before. So I want to bring up one last tool that we developed specifically for Olmsted Now, which was our engagement board. So during one of the last events of the Olmsted Now program was an event called Park Fest, and that was an event where there was activation in 7 parks all on one day simultaneously. And so while before we had done engagement through our various data collection modes that I presented during different days, we had to come up with a different solution to do it all on one day. We developed these foldable, portable engagement boards that basically combined all those methods you just saw into one easily movable board. And we made these to go across the 7 sites. And despite some wind trying to knock them down, we were able to use these to still collect data in a bit of a more lightweight, more mobile way. And so lastly, the conclusion of this project and all this data was producing a report for the project. If you're interested in reading it, it's available on our website, cultureus.cc. And it really goes into all the data we actually collected. I didn't get too much into data today because I really want to focus on the engagement methods, but if you want to see the numbers, they're all in that quite extensive report. So I just want to leave this last thing, which is who here has either conducted a survey or a community meeting or been in one of those situations? Yeah, a lot of us. I've done a lot of that too. I've never had someone tell me it was fun. And this is a quote that we overheard while someone was actually interacting with these data collection methods at one of the parks. They said, "This is so fun. I love doing this." And so, I think it's really important to remember what the usefulness of an in-depth survey of a community meeting is. But as we think about our various, our toolkit of things we have to do data collection, thinking about data collection that is fun and that is interactive, it allows us to reach a lot of people that might not consider themselves people that would want to interact in a survey or in a different way. So I will leave you with that. Thank you very much and look forward to the rest of the conversation.
Thank you, Aaron. I'd like to introduce our provocateur for this panel, who is Nigel Jacob, the Managing Director for Innovation at the Boston Society of Architects. I hope I have your title right, Nigel. So I think what we'd like to do first to kind of kick off, before we kick off the conversation, is ask folks to turn to your neighbor and talk about what does it mean to co-design spaces. From what we've learned today at the panel. And then we will invite our panelists up here and Nigel will help us in guiding a conversation. So just take a minute and talk to your neighbor. It's late in the afternoon. We need to.
Time I see again, but you see
Yes, yes. I will do that.
Hi, folks. We're gonna wrap up the conversations and call our panelists up in just a few seconds. Okay, so thank you, guys. So Nigel Jacob from the BSA is now going to help guide the conversation with our panelists.
So I think the idea, I apologize. Am I on? Am I on? Will you have to do it? Yes. I am. I think the idea here was the provocateur would frame a starting point for discussion for folk, assuming that you all, if you had nothing to say, that I will talk endlessly. I don't have that concern. So I think the idea is I get the first question, and then if any of you have questions, Mir and I have microphones that we can hand around, so that please don't be shy. So again, so my name is Nigel Jacob. I was for many years, I started the Mayor's Office of New Urban Mechanics a bunch of years ago, and I co-led the team for many years. I left recently, and since then I've been the Managing Director for Innovation at the Boston Society for Architecture. Darn it. So I loved all four of the presentations. I've been familiar with a bunch of the work in different ways over the years, and it was all very cool. What struck me was, I think there were lots of questions here around, I heard folk here talking about the question of how do you get power in these, to be able to do these sorts of projects, and how does governance work? And then the questions of like what is data? I mean, I think there was so many answers about what that meant, about how to think about that. But I think the question I wanted to start out with was, how does one, so obviously these kinds of projects can be complicated, right? There's many players, many institutions, large and small, at different scale. How does one avoid that a community engagement process simply dissolve into being performative, right? How do we ensure that these processes aren't simply feel-good moments for the powers that be? Does that make sense, the way I'm thinking about that question? How do we avoid performativity? Not that performance is wrong, is bad, but if it's just performativity, it means people are engaging without with the results not actually leading to any change. How do we avoid that?
I think by the community itself forming its own goals, that if the processes are really engaging and involving people, then it's leading people, getting people to think about what it is that they really want. And then once you have goals, that's what you measure. Are you getting there? Are you getting closer?
Sure. I think another way that really speaks volumes is both scale and repetition. So I think the more people that you can talk to and communicate with and develop that story, the bigger that story becomes and the more weight it holds when you're in shared spaces with state agencies, with governance spaces. I also think repetition is really key, and that you're not only talking with the community once, you're talking with the community over and over again over a period of time that adds to that story, and that you're doing the same in those governance spaces. And so you don't just have one conversation about engagement you did all summer long. You're having 5 conversations about that summer long engagement through every phase of a process.
I think it's a really important question. And I think that there is rightfully so a more recent, I think, push towards doing more engagement for projects. I think there are 2, I think, main things for me. The first is let people be experts in their own experience. I think sometimes an engagement process, we do it because we think we have to, but ultimately you only should do an engagement process if you want to learn from what you hear. And doing that means, one, there needs to be options for what people say to you for that to be enacted. You need to actually give people power and leave that open. And oftentimes I'll be in meetings sometimes, there'll be a street redesign and they'll say, okay, by a Zoom poll or show of hands, so should this be a left turn lane or a straight lane? And it's like, well, I think most people in the room probably aren't traffic engineers. That may not be a really accessible question to ask most people. Either give people the information to understand why that is a question that they should be answering, and also actually listen to what they say, or ask people about their experience. How do you move? Where are you trying to go? What are you trying to do in this space? And then use that to inform your data. Because if we end up asking people questions that we already know the answer to, that we don't give them enough information to actually make a recommendation on, then we don't end up listening to them. So I think that's one really important thing. The other thing I'll say is this was someone, I was at another conference, and the panelist said this when I asked her a question, and I'll repeat it back, which is stop saying you'll look into things. And I think it's about, again, being honest about the bounds of a project and what is and isn't possible. And I think that comes to that piece of it can often be a defense mechanism to say, if someone asks you something, to say, I'll look into it. If you know something is completely out of scope for a project, it's important to be honest with the community, because you're asking for their feedback. You're asking to be honest with you. It's only right that you be honest back with them. And I think giving people kind of really vague answers that say, oh, something might happen, can often give this false sense of hope that can really end up burning in the long run, because ultimately you aren't actually going to live, you can't actually commit to what you agreed to.
I think those pieces that you shared, whether it's community members being experts in their own experience, like you said, Aaron, the longitudinal engagement, Taylor, I think that those are really critical, and just treating and respecting people and community members as full people, and caring about how they're growing and they're investing in leadership pathways is really a way for trust to be built, and for community members to be leading efforts for change, whether it's in planning or programmatic changes in public health. The other addition would be just creating spaces where people can learn from each other around data tools for sharing their experiences, where community visions for a space can be amplified, and creating a space and taking a step back so others can form the coalition together themselves. There's also an opportunity to join existing tables. There's so many groups in the city. There's so many people who have these dreams and visions for their neighborhoods. They're already convening, and joining an existing space means that you care enough to listen. And you, as a planner, you're investing in their leadership to help co-design a space together.
I think also one kind of good test might be, if we're really asking honestly, that there's always going to be something new that came up, and it's, did you learn something? Did something change, in your plan because of the engagement? That's probably a good sign.
So I had one last thing quickly, which is Lydia and I were just talking kind of in the break about, you know, the proposal or for a plan for capping part of the highway through Chinatown with the park. And one of the concerns that you brought up is like, well, it could be just a study. And I think that's also a really important piece about engagement, which is when we are asking people to engage with us, thinking about what are the short-term benefits for people. We often use kind of a pop-up pilot model because if you're engaging in a long-term plan, it's often really difficult to see those actual positive outcomes of that quickly. And so if there's a way to implement something short-term quickly that gives people a direct connection between I said something, I gave feedback, and now it's been enacted. Even if it's not the full vision, that little bit of goodwill and a little bit of showing of commitment can really go a long way to building trust and actually showing people that you care what they say and give you more ability to actually do long-term planning and let people believe that you'll be held accountable.
Cool. Any questions in this moment? Because I have a weird question. I'm not asking a weird question. So while I have you here, so I worked in the city of Boston for about 15 years. And so I've been engaged in community dialogue and engagement and planning many times over. One of the things I've always found strange, an interesting tension is that oftentimes in neighborhoods, resurfacing the past is traumatic. How do we, so when we ask people to engage in a community dialogue, we're asking them to re-traumatize themselves, essentially. How do you all think about that? How do we not craft processes that are about re-traumatization of communities that have had historical trauma? Does that make sense as a question? Okay, what do you think?
I'm happy to try.
I know it's a weird one, but that's my job.
Yes, definitely. Well, I think one thing that's so vital to that conversation is trust. And I know, you know, for someone who looks like me and works for a nonprofit organization, sometimes that's a really difficult barrier to have. And I think what I find and what I've been trying to advocate for is the ability to start by listening and asking and knowing that by starting without questions, and starting by saying, you know, we have this space and this time. Why don't you take the space and the time rather than me? Because we're both here and we want to make sure that we value that time effectively. And I do think, you know, speaking to what Aaron mentioned about being transparent, you know, if you're in a listening session and someone asks you, can we do this? Saying no right away, and sometimes is very helpful because it just will direct the conversation appropriately. And so I think if you have questions, maybe build in that extra time, whether it be 20 minutes of an introduction, that's just a waiting period before you begin what you've actually set out to do with your intention.
I guess for me, I think what's really important is when we're asking people in the community to talk about something that was really traumatic in their life, that they know why and what it's going to lead to and what's the outcome, you know, and is that worth it to them because it's their choice. You know, so the thing that I don't think about this so much in a planning context, but in a lobbying context, like when you're lobbying, you're always trying to drag people around to tell their sob story, right? And it does get, you know, a lot of times people are like, you know, do I have to really talk about this? You know, a lot of people don't feel that they want to, you know, describe all the details of, you know, the difficulties in their lives. But that's sort of like what moves a lot of elected officials and legislators. So it's just really important, you know, when we do that, that we talk about why we're doing that and why it's important for those people to hear, you know, those kinds of details. And then I think afterwards, you know, not just like dragging people out to tell their story, but also kind of like following up, like what happened after that. And we found that when, when somebody knows that they went and they told their story of eviction or displacement, and then, a legislator, said that it really made an impact on them or that they voted a certain way, that makes a difference to people.
Yeah, these are all like really important points. I would also say that if you discover that you are unearthing like community trauma during like a public engagement, you haven't done your work, because ultimately you need any engagement process. But this is coming from the perspective, if a group is coming from outside of a community, I think the first priority is can engagement be done within a community? Is the capacity of that, funding in place, right, for that? If it's an outside group working with a community, doing really appropriate in-depth research beforehand. And I think that is, first of all, doing all the work you can on your own without subjecting people to relive their trauma. You can learn a lot without putting that onus on someone who has perhaps already had to do that a lot and do that emotional labor. And then I think it's, always using a group of people, a small group of people within a community, an advisor group, whatever it is, and compensate them, actually pay them for this work that they're doing, to understand larger context of the community, run your questions by them, run the framing by them, because ultimately that will surface a lot of these things that you might end up, if you don't do that, you might end up realizing when it's too late.
I also want to elevate a conversation I had with my co-author, Suzette. You saw her quotes in the beginning of my presentation, but she was saying that decolonizing data is allowing community members to choose what they want to share and how they want to share it. Having the authority to be able to frame results and choose the path forward with any form of research. So one way to build trust and to prevent traumatic re-earthing of experiences would be allowing people to have access to all findings that are relevant to their communities and taking a step back and listening to how people want to move forward with that knowledge. Other ways are thinking through, like we have a community data work group where people come together and design data stories and data tools for advocacy around the city. And one recently was around needle safety in Boston. A few of the community members had family members who were experienced needle pricks in playgrounds, young children, which were really traumatic experiences. They wanted to tell this story through mapping, through using 311 data, but they also wanted to elevate all of the community resources and organizations that were actively fighting against this to do education campaigns for needle pickup sites. And it was like absolutely critical that those strengths in the community were elevated along with the challenge. So framing things with the strength-based approach, when you're talking about food insecurity, also focus on the community, the amazing, innovative community solutions all around the city that are providing meals, providing nutritious food, and elevating those experiences too.
Questions, comments, feedback? I will keep going. Oh, yeah, please do. Yeah.
We were talking about the context matters.
Hi, Karen Feinberg. We were talking about the World Bank. What does co-design mean with the World Bank? What does co-design mean with MGH? What does co-design mean with grassroots? And the idea of, conceptualizing with, it depends on what the outcome that if you're building a program from concept to market, that's going to look different than some of maybe what you're talking about. And if you're leading a program, you also have to keep the reins a little bit when you're directing a program or something. And so how do you co-design, but don't completely give it away, but don't hold on too much, if that makes sense. I think that's when you talk about tensions. From my experience, it's a tricky ball game, but I think don't you think it depends on the context and what you're trying to achieve?
Sure.
Comment, I guess.
In the sense of context, so specifically with the floating wetland that's out on the river, that has a lot of parameters around it. For example, you know, it has to be anchored to the ground in a particular way that had to go through a series of permitting processes. And so when we think about what is feasible with a project like that, it does have a lot of no's in terms of what can take place, especially when we're talking with youth who really want to put a water slide on a floating wetland to jump into the Charles River. You know, I think which would be really fun. Yeah, exactly. Maybe when we get to, you know, to more of that swimming feasibility, but you know, I think there are ways to frame yeses and nos that maybe relieve some of that tension by leaning into what you mentioned with the why, like why we may not be able to have this particular element or why we can. In a sense, it's not just a no from me because I said no. It's a no because there are, you know, these safety factors and concerns that play into it. And then you're able to have a more focused conversation. And so I think transparency in some of, you know, even scientific data, when people say, is this going to solve all of our problems in the Charles River? No, but it will get us closer to this way. And even if you feel the science is really, you know, it can be over my head in some cases, but you'd be surprised at how quickly everyone is able to learn and be in the same space together, whether PhD scientists to, you know, student in a classroom on a Wednesday.
Yeah, I definitely think that context totally matters, because what the context is, who is designing or inviting people to co-design that process really defines how open are you really, to putting that power into people's hands. And so that's what I love about working for Community Land Trust, because I think we're relatively one of the more open groups. That's sort of our purpose, is to involve people in that type of governance. And we're not just solely focused on one type of solution. So that allows us to be more open to different things. But even for us, there's limits. And I think the most important thing is to put it out there and to give people the same information that you have about what the parameters are and what you're open to.
Anybody else with a comment? Question? Is there? Oh, shoot.
Actually at time. Maybe we do one more question and the conversation continue during the break.
Yeah.
Thanks, everyone. I really appreciate that. Although this topic was called open space, like we talked about a lot more than that. I'm curious if there's anything unique or special to the kind of open space, green space, blue space question that makes this community engagement work different. Anything like that's uniquely opportunities for the positive or negative, that like, because you're talking about open space, you can do X differently, or that you can do Y differently. Like you can use pipe cleaners in a way that you can't when you're talking about other things, right? Like what is it about open space, green space, blue space that is it different than other things that we might be engaging the community about, if anything, or is it just all the same?
That's a very good question. I think that one of the main things that differentiates green space is that we have a strong correlation between green space and public space, green space, blue space, and public space. So I think when we think about engagement processes, the public access to a particular thing that you're talking about is a very important part of the context that we're talking about in an engagement process. And I think there's like a continuum. And I think that there's the opportunity is that there's a lot more sense of shared ownership over many public spaces and many green spaces. That's not universally true. I think we have a rise of privately owned public spaces. Those have a very different context than publicly owned public spaces. And therefore the context of engagement is very different with those. But I would say broadly speaking, in green spaces, in blue spaces, there is a larger sense of shared ownership. And I think that does affect the way we do engagement. It means that there is a different connection relationship between someone doing work or doing a particular project in green space. And I think the challenge is that also people bring a lot more context to that. These spaces mean a lot to people. So I think like there's kind of both sides of that. And I think it is a very good place to learn and test ideas, because I think it is one of the most all-encompassing areas we can work in. And I think it can be applicable for other instances that maybe have different situations and different ownerships.
I also think that, the fact that you're dealing with open, public and green spaces, that it opens up, more possibilities for fun engagement, because, people are there, for different reasons. It's a public space where you can more easily just kind of like grab people and get them involved. And I think also that people relate to those spaces in a different way than they do to other spaces. It's kind of more emotional, more, I don't know, tactile, it's yeah.
Like this. One thing I'll just mention that I actually don't think is unique is that everyone up here has used a tool and some type of engagement tool to receive data and community data. What I do think is unique is the community that you are talking to and the individuals that you are talking to, and that whatever the tool may be, it has to be a tool that speaks to them and that gives them the opportunity to share their story. We were talking quite a bit about this together, but just making sure that whatever that tool is unique to the community, not necessarily unique to collecting data.
I will say, green spaces, right? And that can be often all the different engaging cases. Thank you, everybody. I think we're definitely at time, right? Thanks, y'all.